안녕하세요. 국경없는의사회 지구보건 컨퍼런스에 참여해 주신
Good afternoon, ladies and gentlemen. Welcome to the Planetary Health Conference. My name is Thierry.
한영 동시 통역을 제공하고 있으니 여러분들께서 한국어 채널과 영어 채널 중에서 선택해서 들어주시면 감사하겠습니다. Good afternoon, everyone, and good morning or good evening, those of you who are watching from other locations in the world. I'd like to welcome you all and thank you so much for attending MSF Korea's Planetary Health Conference today. I'm Taeun Kim, the Humanitarian Affairs Representative at MSF Korea. We are providing simultaneous interpretations between Korean and English, so please use the Korean channel or English channel at your convenience. 국경없는 의사회는 작년에
Ladies and gentlemen, MSF have celebrated the 50th anniversary last year, and we are providing various humanitarian reliefs around the world. In French, it is called MSF, Médecins Sans Frontières. So commemorating Earth Day, dated April 22nd, today's conference aims to deliberate on the climate crisis MS have witnessed and the global environment changes and the impacts. We are facing various disasters and crises, and we'd like to highlight their impact on public health, medical care, and humanitarian support. And also, we'd like to deliberate on why planetary health crisis is a humanitarian crisis. And we will also hear from various humanitarian organizations on their current responses and how they work on these issues together, and we'll deliver on the issue together. Also, we have many people joining live in Korea, and we have a proof shot event for you. We will select 30 people and give away MSF Korea's partner company, Yes, It's Coffee's eco-friendly coffee meal candle. So we cordially invite you to the event. You can find more information on the link we shared in the chat. So before we begin the sessions, I'd like to invite MSF Korea's General Director, Thierry Coppens, for welcome remarks. General Director Coppens has been heading the Korean office since 2015, and before that, for over 2 decades, he served in Rwanda, Haiti, Lebanon, totaling 18 countries, and operated humanitarian emergency relief projects. He has vast experience in humanitarian crisis. Ladies and gentlemen, please welcome General Director Coppens. And I'd like to ask your understanding if the audio wasn't clear. Let's welcome our General Director Coppens.
Good afternoon or good morning. Excellencies, distinguished guests, and dear MSF friends, on behalf of Doctors Without Borders, Médecins Sans Frontières in Korea, I'm really pleased to welcome you to this conference marking Earth Day 2022. As it is mentioned in the 6th assessment report of the IPCC, human-induced climate change, including more frequent and intense extreme events, has caused widespread adverse impact and related loss and damage to nature and people beyond natural climate variability. The rise in weather and climate extreme has led to some irreversible impact as natural and human systems are pushed beyond their ability to adapt. For the past decade, MSF has long responded to some of the world's most critical medical and humanitarian crises. Many of the areas where MSF works are in the most climate vulnerable settings, and MSF teams have been bearing witness to people experiencing the health impact of the climate emergency, recognizing the medical and humanitarian consequences of climate change and environmental degradation. MSF has been putting efforts into moving towards integrating the broader consideration of climate change and health under the umbrella of planetary health with patients at the center. Climate change is already causing and will increasingly cause a surge in medical needs that will fall within MSF's scope of work, including, amongst others, malnutrition, respiratory and cardiovascular illness, and changing disease patterns. The climate emergency aggravates existing vulnerabilities and humanitarian situations such as food insecurity, and its consequences are encompassed with the narrative of governments, international and national institutions, and civil society organizations. Its health impacts are largely absent. Climate change has been described as the biggest global health threat of the 21st centuries. The aim of today's conference is to raise public awareness of the humanitarian consequences of this climate emergency and bring together experts from non-governmental organizations and international and national institutions to share knowledge, experience, and best environmental practice in climate emergency mitigation and adaptation measures. We wish that this conference contributes to the narrative that climate change, environmental degradation, and the impact on the health of millions of individuals exacerbate the existing vulnerabilities. As humanitarian actors, it's one of our duties to be a witness to what we see in our daily activities and how we should adapt our medical response to better address these needs in a rapidly changing reality. We should be also innovative and accountable for how we deliver aid in a sustainable and effective way without harming the living environment of population and by adapting our modus operandi. The climate emergency is a threat to the future of our planet and the health and well-being of millions of people around the world. Urgent action must be taken now to prevent more human suffering. On behalf of MSF Korea, I would like to thank His Excellency, President and Chair of the GGGI and 8th Secretary General of the United Nations, Ban Ki-moon, for his congratulatory remarks. I would like also to express my gratitude to the panelists for sharing their knowledge and dedicating their time to making this event a success. MSF Korea is delighted, of course, to welcome all our guests attending this conference from various locations in the world. I wish you really a successful conference. Thank you very much.
Dr. Thierry Coppens, distinguished panelists, experts, and guests, ladies and gentlemen. First, allow me to express my appreciation for the kind invitation to join this event on the climate crisis and its impact on the health of the planet, organized by Médecins Sans Frontières, MSF Korea. During my tenure as Secretary General of the United Nations, I visited countless places throughout the world where support for local medical and health needs was so crucial. I was always very appreciative of those who were there to help the local people. They were often providing their services to help others, despite the very significant risks to themselves. And I'd like to express my warmest thanks to all of you humanitarian responders and commend you for your dedication, sacrifices, and the sense of devoted service to your fellow mankind, no matter to which organization you belong. I'd also like to express my warm congratulations to MSF Korea for organizing this important conference, which comes at a very important time in human history. I'm very pleased to know that both discussions on planetary health will take place as a result of this conference. The COVID pandemic has hit the entire global community in an unprecedented manner. Some estimates have put the total global cases at 500 million and total COVID-related deaths to be more than 6 million. The International Monetary Fund, IMF, estimates it will cost the global economy more than $12 trillion. It has demonstrated a clear correlation between human activities such as the destruction of natural systems, which have served as a buffer zone between wildlife areas and human communities, and an increase in novel infectious diseases. It has revealed serious deficiencies in public health systems, and it raises serious questions and grave concerns about the unknowns of long COVID and the looming mental health crisis, just to name a few. When we consider that the climate crisis and the increased frequency and severity of extreme weather events are clearly a result also of human activity and are having a multiplying effect on many humanitarian crises, it is essential to adopt a planetary health perspective to any discussions on possible solutions and responses. And I'm certain that I do not need to remind any one of us that the developing countries and the most vulnerable groups of societies are the least able to withstand or address the effects of both the climate crisis and the COVID pandemic. Ladies and gentlemen, we have recently passed the 2-year mark since the World Health Organization declared the start of the COVID pandemic in March 2020. I believe this Planetary Health Conference is very timely. We need to review the existing knowledge on planetary health and use this lens to approach how we should address the humanitarian impact of the climate crisis. I hope this conference can serve as a useful platform to share experiences and best practices, as well as to explore how humanitarian responders and other experts might best respond and adapt to the impacts of the climate crisis as they continue to do good work out in the fields. I thank you again, and I wish all of you a very green and successful conference. Thank you.
네, 반기문 의장님 축하
Many
말씀.
thanks to His Excellency Chair Bang Ki-moon. He was not able to attend in person today due to his previously committed schedule, but I believe it is indeed meaningful to have and accompany the MSF in our footsteps, trying to integrate the issues on planetary health and the humanitarian crisis. I heard that we had some issues with the audio in the Korean channel. I would like to ask for your kind understanding, and I hope that we will not have such issues in the remaining parts of the session. Now, before we dive into the presentation sessions, I would like to first introduce Professor Yong-sang Choi from the Climate Energy System Engineering Department of Ewha Women's University. Professor Yong-sang Choi is a renowned scholar in the field of climate physics, and he's carrying out many research projects regarding various issues on the planet and environment, such as climate sensitivity and changes to the ecosystem. In particular, he established the social enterprise Rainbird Geo to enhance the capabilities of early warning for disasters of Southeast Asian countries, one of his many interdisciplinary accomplishments. I would like to extend my sincere gratitude to Professor Choi for taking time to participate today, and now we can begin with the first presentation session. Thank you.
안녕하세요. 방금 소개받은 이화여대 최용상 교수입니다.
Everyone, I'm Professor Yong-sang Choi of Department of Climate and Energy Systems Engineering at Ewha Women's University. The topic of the first session is climate crisis and humanitarian efforts. And I believe that the climate crisis and humanitarian efforts, you might think, how do they link together? And if you thought those two concepts existed in silo, I think today's session will help you understand two things are closely connected. Now, climate change and climate crisis are no longer a new term. There has been a lot of dialogues on this topic, and there's been a lot of discussions as well. And today we invited very special presenters to learn more about this. So first, presentation will be presented by Ambassador and Deputy Minister for Climate Change, Kim Hyo-eun, from the Republic of Korea. Let me introduce her to all of you. She served as a Director of Strategy, Policy and Communications at Global Green Growth Institute, which was established in 2012. Later, she served as a Deputy Director General at the Institute. And since July last year, she is actively serving as Deputy Minister for Climate Change, in particular at the COP26 held last November. She led the carbon neutrality declaration negotiations as the Korean government's deputy representative. So please feel free to leave any questions in the YouTube chat if you have any questions while she gives presentation. And we will cover the questions after the panel discussion. Ladies and gentlemen, please welcome Ambassador Kim Hyo-eun. Her topic is on the decade of action towards carbon neutrality. Please give a big round of welcome. Hello, ladies and gentlemen. My name is Kim Hyo-eun. I'm the Ambassador Kim Hyo-eun. And thank you so much for inviting me to such an important conference. And today, I think it's very meaningful that we will be discussing on the two things together, climate change and also humanitarian impacts. Moving on to the next slide. So I will start from the Paris Agreement. So 2015 was an important year in this climate change discourse around the world. It's because Paris Agreement was adopted in this year. So before Paris Agreement, the climate change actions were the responsibilities of developed countries. And you will see CBDR, common but differentiated responsibilities on the slide. So when you think about the countries who started industrialization early, so they are developed countries, they had the responsibility to reduce carbon emissions. But the countries who have less responsibility or contributed less to carbon emissions, they do not have the responsibility to reduce carbon emissions. That's the core of CBDR principle. However, in Paris Agreement, it required all developing countries and also developed countries to participate in reducing the carbon emission. You will see NDC, Nationally Determined Contribution. This is applying to all countries. So all countries have to decide how much carbon emissions they want to reduce voluntarily, and they will report that. They will submit that NDC. So after the adoption of Paris Agreement, all countries have to participate in reducing carbon emissions. There was an international agreement on this. Moving on. So, is there a scientific basis to climate change? There were a lot of talks about this. However, IPCC is an international organization, reported this assessment report, participated many scientists, have proved that climate change has clear scientific basis. And the report says the climate change is a clear threat to the humanity. IPCC, as you can see on this slide, have reported 6 assessment report. And in 2018, they have reported on the special report called 1.5 special report. So every time the assessment report was submitted, the international community took another step in climate change efforts. Moving on to the next slide. IPCC showed various science-based evidences on climate change and how climate change is bringing havoc on the earth. And it's well explained in the report. Climate change is clearly there, and it's backed up by science. And the reason of climate change is human activities. It's the greenhouse gases that are emitted by humans. And because of global warming, it's going climate change. If this trend continues, we will face climate crisis. And moreover, we might face climate disaster. And there were a lot of science-based evidences that explain the trend. Moving on to the next slide. So you would have noticed extreme weather events recently. We had frequent wildfires or floodings or cyclones or the cold snaps. So it's beyond our imagination in terms of their size and frequency, and these extreme natural disasters occurring at an unprecedented rate. And these disasters are threatening the lives of human and animals and plants. And as a result, climate change or climate crisis leads to the life and death of humanity. Moving on to the next slide. So this is a shot taken at this UN Climate Change Conference held in Glasgow, UK. So I captured the moment. So moving on to the next slide. So this COP26 was held in UK. So it is 26th, the Conference of the Parties was held in UK last year. And at this meeting, it wasn't just a meeting for governmental officials. It included all the stakeholders. The whole of the society were involved in this event. So as you can see from this slide, so there were many negotiations, and at the same time, for example, November 3rd was the Finance Day, and November 4th was Energy. So there was a day themed around a particular area. So the parties of UNFCCC joined this meeting, but during those thematic days, for example, finance, then we had the finance stakeholders or the civic society leaders in the finance area. So all the stakeholders participate in the meeting. So it was a very comprehensive meeting discussing about climate change from various fronts. The discussions about climate change is not a discourse done by political parties. It has become a very inclusive dialogue that includes various parties. It is very comprehensive dialogue. I would like to stress that point. Moving on to the next slide. So at the Glasgow conference, 120 world leaders gathered together for that event. And at the World Leaders Summit, there were many important issues that were agreed upon. So if you look at the second point, clear signal 1.5 Celsius degrees in reach. So this means that until 2100, the average temperature rise should be kept within 1.5 Celsius degrees. So world leaders agreed upon this. So earlier I mentioned about IPCC special report or an assessment report. In 2018, it has submitted 1.5 special report on 1.5 Celsius degrees. And that report is all about we have to maintain the temperature rise to 1.5 Celsius degrees compared to pre-industrial level, because if the temperature rises beyond 1.5 Celsius degrees, it will experience so many extreme weather events. And in order to stop and mitigate those extreme events, it will require a huge effort from the humanities side. So the most important agreement, or mostly mentioned number, was 1.5 Celsius degrees. And in order to reach this 1.5 degrees goal, by 2050, we must reach carbon neutrality. So that's in the middle of this century, carbon neutrality has to be met. The net zero has to be met. And there was a very strong recommendation from IPCC. So in order to reach 1.5 Celsius degrees, the leaders came together and agreed upon the goal. So in other words, the world leaders have agreed on reaching net zero in 2050. So they basically mean the same thing. And not only that, in order to reach carbon neutrality by 2050, by 2030, we have to dramatically reduce carbon emissions. And so this COP26 in Glasgow, so by 2100, we will reach 1.5 Celsius degrees, and by 2050, we'll reach net zero, and we will reduce carbon emissions by 2030 through ambitious NDC. Those three pillars were the most important crux of the Glasgow COP26. So after the World Leaders Summit, a lot of negotiators got together and agreed upon this Glasgow Climate Pact as the final decision. The Glasgow Climate Pact is the decisions the participants agreed upon, and they are the main elements in this climate pact. So as I mentioned again, so it says it respects the scientific evidences introduced in IPCC 6 assessment reports, and also to help developing countries to adapt to climate change, we will expand the support. In particular, to help developing countries adapt to climate change, by 2025, the leaders agreed on creating the Adaptation Fund and increasing the finance by twofold. And not just that, I mentioned that 1.5 Celsius degrees by 2100. And in order to that, I mentioned that we have to reach net zero by 2050 and reduce emissions by 45%. We have to cut emissions by 45% by 2030. So there was an agreement on these three elements. So in order to cut the emissions by 45% by 2030 and reach the net zero goal and 1.5 Celsius goal, we have to reduce the fossil fuel generation, and that is a huge, it plays an important role. So here, as you can see, to phase down the coal power plant and phase out inefficient fossil fuel subsidies. So this was agreed upon by the leaders at COP26 as well. And not just CO2, they agreed upon reducing methane. It's also a greenhouse gas. Methane was the first time that was stipulated in the agreements during this UNFCCC dialogue. And also on top of that, in order to respond to climate change, in order to help the reduction of carbon emissions, it will require finance, technological transfer, and capacity building provided to developing countries. And the leaders also agreed upon this as well. So by 2025, they decided to deliver $100 billion annually. And also beyond 2025, let's negotiate on the new climate finance and finalize it by 2024. And also, we call this Paris Agreement rule book. So this covers a carbon market. So this is also called like reducing carbon emissions beyond your border. So a country should focus on reducing carbon emissions within your border, but at the same time, if the country reduces the emissions in the other countries, that amount can be taken back to the amount of your carbon deduction. So there was some agreements made regarding this. So at Glasgow meeting, so every 5 years, the countries must report on their plans of NDC. So many countries have submitted their NDC plan until 2030, but every 5 years, they have to update their NDC plans. Moving on to the next slide. So there are some general assessments regarding COP26. There are divided opinions about the COP26. Some people say the result is disappointing because so many countries get together at COP26. There were many promises made at COP26, but when they are all put together, is it possible or is it enough to reach 1.5 Celsius degrees goal? But when we put it all together, it is not enough to reach 1.5 Celsius degrees goal. So it will require stronger commitments of countries. Since the countries' commitments were not sufficient enough to reach 1.5 Celsius degrees goal, that is why some people criticize the result of COP26. However, most of the participants say that COP26 resulted in balanced outcome. It's because all UN members decided to work hard to reach 1.5 Celsius degrees. It's like India, China, and Saudi Arabia, those countries who rely on fossil fuels, even they joined the declaration of reaching carbon neutrality. But for China, 2060, Saudi Arabia, 2060, and India, 2070, are the years they decided to reach carbon neutrality. Yes, it is later than 2050. However, it is a great progress for those countries. The COP26 held in Glasgow, as I mentioned earlier, involved all stakeholders. It was an international conference that encompassed not just political representatives, it included private sector, civil society, youth, and general public. Everyone who are related to climate change, all the stakeholders participated in COP26. And in order to push climate change action further, they voice themselves out. And also, another thing to note that business and finance sectors are playing a leading role through the COP26. You probably heard about RE100 or EV100. RE100 is RE100 is renewable energy 100 and EV100 is electric vehicle 100. So what they mean by that is for companies, when they adopt RE100, they will use 100% renewable energy in their businesses. And it is a voluntary pledge that they make. And for EV100, the companies pledge that they will use EVs in all their operations. So that's EV100. So the business sectors and finance sectors, and they are participating in very proactive climate actions. And not just that. So on the sidelines of the UNFCCC, the countries and various alliances and various coalitions are creating new initiatives. For example, Major Economies Forum. It is led by the US. About 20 countries are participating in this MEF, and they discuss climate change. The 20 countries who are participating in this forum are responsible for 70% of the global emissions. So these 20 countries if they adopt proactive actions in terms of reducing carbon emissions, then it will result in it will contribute greatly to the global carbon emission cuts, and US is leading it. And Germany have initiated G7 Climate Club. And they in Germany said like the countries who will lead the effort in carbon emission cut should form this climate club. Oh, there's also another initiative called Zero Emissions Vehicle Transition Council. They work on expanding the EV adoption. And also there's another alliance called Powering Past Coal Alliance. It's to phase out coal. And not just that, private companies and business actors, they are joining efforts. So for example, Transform to Net Zero, who joined this initiative, they are making their operation net zero. So there are the companies who are using renewable energies or EVs in their operations. So the companies are voluntarily participating in these climate actions. It's because unless they proactively work for net zero, investors would not favor them in their investment. And also consumers will walk away from them. So this is the new world we are transitioning into. So Republic of Korea is actively participating in climate action. We are working very hard, and I can proudly say that Korea is one of those countries working very hard for climate action. Korea has promised to achieve carbon net zero by 2050, and also we have submitted enhanced NDC to reach 40% reduction by 2030. Korea relies highly on coal, and it is difficult for Korea to phase out coal. However, despite all those challenges, Korea has submitted very ambitious NDC. In order to reach this NDC, it's not just the department, the whole countries are working hard for this one goal. And also next month in Seoul, World Forestry Congress will be held. Forest absorbs carbon emissions, and this Congress will be a very important venue to discuss about the importance of forest. This was my last slide. And lastly, I would like to end with this remark. Reducing carbon emissions is not a matter that we can stop or fall back on. In order to reach 1.5 Celsius degrees goal, this needs to be pushed forward, and it should be, and it will continue to be pushed forward. This 1.5 Celsius degrees is not met, the humanity will face drastic results. If we think about that consequences, then we will work very hard to reach 2050 carbon neutrality goal and cutting emissions by 2030. Thank you for listening to my presentations. Thank you.
네, 대사님 발표 너무 감사합니다.
Thank you, Ambassador, for your wonderful presentation. Through your presentation today, I think the goal of reaching carbon neutrality of Korea, reaching carbon neutrality by 2050 and the reduction target by 2030 is definitely cost intensive, but we could understand that it's important to be aligned with the national goals, also on the global level. In order to achieve net zero, companies also have to think about how it could affect their sustainability. So achieving net zero for companies will become a future direction for their survival. I think it was a very insightful presentation in that regard. Thank you very much. Next, allow me to introduce the second presenter, Dr. Maria Guevara, the International Medical Secretary of MSF International. Dr. Guevara was a physician in the United States, and she started working in the field of MSF starting in 2004 in Liberia, Haiti, Nigeria, and the Republic of the Congo.
현장에서 활동을
She
하시라고
worked
했습니다.
extensively and has a lot of experience in the field. Afterwards, she served as the MSF Regional Humanitarian Representative in Asia, the Senior Coordinator for Attacks on Healthcare, and Senior Advisor on Global Health. Today, based on her experience working in the front lines, she will give us a presentation on behalf of the MSF titled The Planetary Health, Climate Consequences, Impact on Vulnerable Population and Humanitarian Response. Along the presentation of Ambassador Kim, I think it will be an insightful opportunity for us to increase our understanding on the respective issues. If you post your questions into the YouTube chat during her presentation, we can take them later to be answered in the Q&A session. Then allow me to invite Dr. Maria Guevara for her presentation. Let's give us a warm welcome.
Can you hear me okay? Okay. So, annyeonghaseyo to all, and greetings from Geneva. Thank you for the warm welcome, Professor, and to MSF Korea for extending the invitation to me to speak in the stead of actually Stephen Cornish, the General Director of MSF Switzerland, who is currently on field deployment in Ukraine. I am honored to take his place and be part of this event on this special day when we give voice to planet Earth, our home, our life support. It is also a sincere privilege to share with you all today two of my greatest passions, medical humanitarian action and planetary health, and to have them both be spoken in the same context. It has been a long time coming, and it grows more critical every day. There is much to say and do about these topics, and seeing as the more practical actions and field examples will be discussed further in the next panel discussions. I've focused mainly on the reasons why climate change and environmental degradation are health and humanitarian concerns, and why planetary health is relevant for aim to see this through. Every year on April 22, Earth Day marks the anniversary of the birth of the modern environmental movement in 1970. In this picture that starts from 1970, you see an image of the Aral Sea over 4 decades. And what it shows is it only took 40 years to dry up this lake that once covered an area of 68,000 square kilometers. If you were to look up the Aral Sea in the Wikipedia today, it's written usually in the past tense. It was called the Sea of Violets, is what I understand Aral Sea means, as there were all these 1,100 islands that were dotting its water. And in the 60s, the Aral Sea was considered the 4th largest lake in the world, running the border between Kazakhstan and Uzbekistan in Central Asia, where we still have projects today. Since then, the Aral Sea has shrunk to 1/10 of its original size through the Soviet Union's diversion of water from the 2 rivers that fed into the sea for irrigation to grow cotton and wheat. And the water that had grown increasingly salty and polluted as it dried up with fertilizers and pesticides in the cotton field, draining into the bottom those pollutants and sinking to the bottom sediments, which then turned into salty contaminated dust that blew across the fields at about estimated 40 million tons a year. And this turned into a public health hazard, causing respiratory illnesses and other cancers. In 1997, MSF developed a medical program to address the major causes of morbidity and mortality, namely addressing tuberculosis, acute respiratory infections, diarrheal diseases, and anemia, to serve the populations that were remaining in the surrounding towns. And in 1998, MSF launched a website on Earth Day that year, which was International Year of the Ocean, to raise awareness and stimulate discussion on the very real human and health impact of the environmental tragedy of the disappearing Aral Sea. By 2014, as reported in the October issue of the National Geographic, the Aral Sea's eastern basin was dry for the first time in 600 years, thanks to continued irrigation and droughts, partly due to local climate change as a result of human-created desertification. So what does a human-triggered climate change mean? This slide shows historical trends in carbon dioxide concentrations and temperature on a geological and recent timescale. At the top of this graph are the CO2 concentrations measured, matched with the corresponding temperature measurements below it. So to the left of the graph, you'll see the most recent geological history, the last 100,000 years, which we know as the ice ages. And at this period of time, the temperatures were low and continental ice sheets covered large parts of the world. Through the ice core analysis of ancient air that's trapped in tiny bubbles in the Antarctic ice, they've been able to see what those temperature cycles were at the time, and also the concentrations of the carbon dioxide. If you move to the right, which represents the more recent history from the Middle Ages and up until now, shows increasing temperatures rising from the Middle Age around 1850 and skyrocketing later on into the 1900s through the industrial era, when human activities have at the same time increased the level of carbon dioxide in the atmosphere. So primarily through the burning of fossil fuels. Carbon dioxide is one of those main greenhouse gases, and scientists have been able to connect to human activities to as one of the drivers to climate change and global warming. And you can see that even in 2021, we have systematically remained at above 400 parts per million, when previously the average had been around 250 plus or minus. So in a nutshell, tens of thousands of scientists in more than 100 nations have amassed an overwhelming amount of evidence pointing to a clear conclusion: humans are the main cause. We are the ones who burn fossil fuels, produce livestock and clear trees, increasing the amount of heat trapping gases in the atmosphere. So what are we talking about now when we talk about planetary health? Does it matter? Does terminology matter? When you see planetary health, environmental health, climate, environment, and health, One Health, Eco Health, it is a matter of where you focus it. So there are many multiple approaches, as you've just seen. Environmental health, perhaps the oldest and most familiar, especially to MSF, when we address the pollution and disease at once. The climate, environment, and health has at least climate change and health has a 30-year history of research in global warming and health, with arguably solid evidence. One Health focuses on animal, human, and environment, but mainly on the two interaction between animal and health, focusing mainly on AMR, or antimicrobial resistance discussions, infectious diseases, and Eco Health is similar, with a stronger focus on emerging infectious diseases. What matters is that we look at the whole as an ecosystem, where the health problems in human populations arise from the interaction between humans, animals, and the environment. And for us, the planetary health, which is the newest of the disciplines, creates an umbrella term that encompasses all the elements of the other disciplines mentioned. It especially highlights the human responsibility in causing the decline in a natural ecosystem as we approach the planetary boundaries of processes as climate change, land system change, biodiversity loss, global pollution, and such. It basically puts humans at the center in indirect connection with its natural ecosystem and highlights the responsibility aspect that we contribute to this relationship and are responsible to some of the causes of decline in the natural ecosystem, which then becomes a threat back to us. As a new global health discipline, it also emphasized the real urgency and need to act now on this issue that we are failing as humans to address. And it also encourages the crossing of boundaries and powerfully highlights the importance of interdisciplinary work, requiring building assistance and developing partnerships across sectors, emphasizing the point that we cannot address this challenge alone. The IPCC, what it is and what they do. You have already heard from the great presentation of Her Excellency the Ambassador, so apologies for some of the duplication. The IPCC, or the Intergovernmental Panel on Climate Change, having been established in 1988 under the United Nations Framework Convention on Climate Change, is headquarters in Geneva. It involves thousands of scientists and other experts from around the globe that compile and assessment reports every few years. And now we are seeing the 6th report that have just been published. They do not per se conduct original research, but review and synthesize the best available evidence, serving as the largest scientific collaboration and peer review process in the world. Its main role is really to highlight and provide objective scientific information on climate change, which includes the risks, which is the Working Group 1 report, the impacts, Working Group 2, and responses, Working Group 3. So this is important for us as at MSF, because much of our work and much of the focus that we put in is on science and evidence-based research in the practice that we translate that into. But the bottom line message of this report is rather grim, as already been stated by the ambassador, that the planet is no doubt heating at a rate never seen before, and it's our fault because of our fossil fuel use and many other activities. There's really little hope remaining of avoiding a worst case scenario, especially if we don't act now. And the effects of the climate change will be overwhelmingly negative, with the most vulnerable being the most impacted. So what does it show? The report unequivocally links climate change to negative health impacts, from the extreme heat causing increasing disease and death to increasing incidence of foodborne, waterborne, and vector-borne diseases, for more malnutrition due to rising food insecurity, the emergence of new infectious diseases, especially of animal origin as COVID, the rise in chronic diseases as heart and lung diseases, and more frequent and more severe extreme weather events. Climate change and environmental degradations also contribute to violence, conflict, and population displacement. And for the first time, this report mentions mental health being negatively impacted by climate change. And this is important to note. As Thierry mentioned in his introductory speech, the Director General in 2016, Dr. Margaret Chan of WHO, stated that climate change is the defining issue for public health in the 21st century. The evidence is overwhelming. Climate change endangers human health. Solutions exist, and we need to act decisively to change this trajectory. That was already in 2016, and we are 6 years later. Essentially, climate change threatens your health. It doesn't matter where you live, basic necessities will be disrupted. Climate change is expected to cause approximately 250,000 additional deaths per year between 2030 and 2050 from malnutrition, malaria, diarrhea, and heat stress alone. And the direct damage costs to health is estimated to be between $2 to $4 billion per year by 2030. For MSF, a large portion, perhaps a majority of the health problems managed in our projects are climate-sensitive diseases, mainly referring to the infectious diseases we encounter in the field, as malaria, dengue, or yellow fever. A few others are newly emerging infectious diseases, such as COVID. And of the 30 or so new human pathogens detected in the last 3 decades, 75% of them have originated in animals, or what is called zoonotic diseases. What is causing this increase in zoonosis? Essentially, the increasing interface between humans, animals, in the same environments. Climate change, the warming temperatures, the soil moisture will increase precipitation, affects habitats and life cycles of vectors and feeding behaviors. The land use changes, deforestation, dams, and irrigation schemes increases further exposure to diseases such as malaria, schistosomiasis, Japanese encephalitis. And the biodiversity loss shows that, as we know in Darwinian concept of survival of the fittest, the more competent vectors or hosts for diseases survive the most as a result of habitat fragmentation or of other human actions, which includes industry, agriculture, animal husbandry, and wildlife trade. Again, emphasizing humans' core impact due to our activities. This is a tale of two maps. The first map is on the top left corner, is a map from the Notre Dame Global Adaptation Initiative Country Index, which summarizes countries' vulnerability to climate change and other global challenges in combination with its readiness to improve resilience. It is a map of the estimated overall vulnerability and preparedness for climate change, and the darker shades show the countries with higher vulnerability. In the top and the bottom right is the map of MSF activities in 2019. And you can see where those have strong overlaps. Essentially, climate hotspots are also humanitarian hotspots. We have been working in these regions for many, many years and have been seeing the growth of these increasing diseases. So climate change is a humanitarian concern. Humanitarian action based on humanitarian principles inherently means responding to the needs of the most vulnerable through saving lives, alleviating suffering, and promoting dignity. Climate change increases that vulnerability, especially for those already most vulnerable, yet with the least capacity to bounce back. The reality is that the climate change impacts are not equally distributed, and regional variations gravely amplify risks for populations who already lack adaptive capacity to begin with, due to existing vulnerabilities and inequities. As it is, humanitarian assistance to many of these populations, especially in conflict settings, is often severely hampered and compromised, leaving them even more vulnerable. Essentially, the poorest with the fewest are the most affected and end up being left behind. And sadly, these climate hotspots are blind spots for many in the rest of the world. And this has been reaffirmed in the IPCC 6th report. And what are we doing in MSF about this? As mentioned previously, we have been looking at this for quite some time already. And what we do regarding this is really putting the link between climate change, environmental degradation, and health under the Planetary Health frame to do what we do better, smarter, and more efficiently with an ecological planetary health lens. We have formulated our actions through this planetary health approach into three pillars: the operational adaptation, environmental footprint mitigation, and advocacy with climate witnessing. So in operations, we are working on our adaptive resilience and on how to better respond with a short-term as well as long-term sustainable outlook, building on analysis, assessment, and a strong focus on anticipation. On footprint, MSF views this in the spirit of the do no harm principle, and we take our social responsibility to organize and measure ecological footprint mitigation. And on advocacy, we see this as not being about establishing a cause and effect, but highlighting what is being experienced in real time and bearing witness to this, giving it public narrative, and highlighting our experience that climate change is a human health issue. But we don't do this alone. While we build our own practice, experiences, and expertise to be climate smart, what is critical in climate action is working with and learning from others, acting together. We are fortunate to work with organizations as Health in Harmony, Healthcare Without Harm, Climate Action Accelerator, the Red Cross Red Crescent Movement as ICRC and IFRC, and others. We have done a lot to report on this, on what we've witnessed on the ground to date, publishing the Lancet Countdown for the past 4 years, presenting and adding our voice also at the COP26, and doing what we can to raise awareness on the issue, as well as joining others by pledging to reduce our emissions by at least 50% compared to our 2019 levels by 2030, and signing up to the Climate and Environment Charter for humanitarian organizations, along with other nearly 200 humanitarian organizations have signed thus far. So as we come full circle of this presentation, starting with a call on Earth Day in 1998, in the case of the disappearing Aral Sea, with this Earth Day in 2022, we call for the need to build that bridge back to Earth, a partnership for and with the planet. To quote our MSF International President, Dr. Christos Christou, human health will be increasingly damaged by the negative consequences of the climate emergency. Failing to act now would mean breaking our medical and ethical obligations towards patients and communities. So let's make every day Earth Day, invest in our planet, and act now, together. 감사합니다. Thank you.
네, 마리아 구에바라 박사님.
Thank you very much, Dr. Maria Guevara, for sharing the wonderful presentation. It seems like you're presenting from Geneva. It's only 9 a.m. now. So considering that you have joined us from the rehearsal, you joined us so early in the morning. Thank you so much for insightful presentation. And through your presentation, I understand that climate change affects waterborne diseases, the displacement of humans, and also various vector-borne businesses or food insecurity even, that how climate change affects all these areas comprehensively. And also that climate change seems, I clearly understand climate change poses great threat to vulnerable groups. So from now, for about 30 minutes, I would like to invite two presenters to join us for this panel discussion. I know you have worked very hard for the presentations, but thank you so much for joining us for the panel discussions once again. We received some questions from our participants, and I'd like to share those questions to our presenters. So my first question would go to Ambassador Kim. It will also go to Dr. Guevara as well. But first, I will ask this question to Ambassador Kim. So the first question is, as Ambassador Kim has mentioned, from the climate mitigation point of view, we are working on reducing emissions. So does that come first? The carbon emissions reduction, does that come first? Or should we support people who are affected by climate crisis so they can adapt to the climate crisis? So what comes first? Of course, both of them are important. Mitigation, adaptation is both equally important, but we have limited resources. So my question is, what would come first? So it was a question from the participants who are joining. So I will also ask this question to Maria, but I will ask Ambassador Kim to answer first. It is a very difficult question, and at the same time, it is a very critical question that we must think up. And so my answer is, I would like to give conclusion first. So even though it's challenging, we have to work on both together simultaneously. So mitigating climate change would require a long period of time. and it requires technology, it requires financial support. So it cannot be done in 1 year or a couple of years. It's imperative that requires a long period of time. So we talked about keeping the temperature rise to 1.5 Celsius degrees by 2100. So it's not just for our generation, it would require a future generation to work on this imperative together. But at the same time, as Dr. Maria Guevara mentioned, there are groups who are affected by climate crisis, and there are a lot of them. And unfortunately, climate change disproportionately affect the vulnerable groups. For example, developing countries, extremely poor countries, women, children, and those people who are working in the primary industry. So these vulnerable groups are affected by climate change much more. So we need to implement various protective measures for these vulnerable groups. Unfortunately, the developing countries do not have enough finances or technology to protect their vulnerable groups. That is why through UNFCCC and also through various international discussion, along with mitigation efforts, there have been a lot of talks on supporting developing countries in terms of adaptation. So in Glasgow meeting as well, how fast and how far, how effectively, efficiently are we going to support our developing countries in terms of finances and also in terms of technology? That was a very important agenda. And the vulnerable groups in developing countries, if they are not protected properly, responding to climate change will become even difficult. So let me emphasize one more time, protecting vulnerable groups and mitigating climate change, they are both important issues. Although it is challenging, they must be tackled all together simultaneously. Thank you so much, Ambassador Kim. So I would like to ask the same question to Dr. Guevara. Please share your ideas.
Yes, thank you. And I will have to echo Ambassador's comments that it must be done in parallel. And for an organization like MSF, while we're not states, this is actually the bread and butter of our work, is to address the vulnerable and provide services for them. But how we look at it is basically adaptation and mitigation are essentially two sides to the same coin, where you look at prevention of clinical disease and the cure of clinical disease. And this too have to come in parallel, and they are not, it's not one or the other. They have to go together. But what we do want a push for as a start is to understand what our roles can be regarding the first do no harm principle of ensuring that when we do provide services, we are very cognizant and responsible in the way we actually set those projects up. And so we need to understand how do we better mitigate our practices in a way that is most environmentally responsible, as we learn also to adapt, predict, analyze, and use tools that we can help better target the most vulnerable and address the diseases at once. And also one of the things we do is ensure that we learn from other actors and the lessons that they've learned. So part of the partnership that we have as well with Healthcare Without Harm is understanding what does it mean for a greener health system, knowing that from their statistic, the health system globally is probably contributing, is a fifth of the contributors to climate issues as far as carbon emissions. And so, or at least creating environmental hazards. So it is very much an ethical obligation to really look at that part, the mitigation aspects. But we also address the actual delivery of care, and we need to continue to adapt our ways to do that in a more environmentally responsible way. So the same, in parallel, adaptation and mitigation works together, and even adaptation in itself can be a mitigation factor. Thank you.
네, 기본적으로 이제 두 분의
Thank you
의견이
very much. So both of you were on the same side, and also Dr. Guevara mentioned that a prevention of diseases and treating diseases are just like it's like the same. And I would like to move on to the next question. And the next question is, what would be some ideas for individuals to participate in adapting to climate crisis and mitigating climate change? So after I saw this question, I had some thoughts. So when we study the survey OECD, 67% of the people said that the individuals' actions are more important than the businesses. And the survey result shows that individuals should play more effort, and that was the OECD average. But in Korea, 86% of people responded that the companies and governments should play more greater role than individuals. So I think this question is about individuals who are seeking ways for them to participate in these climate actions. And at the same time, there is a context that, a lot of Koreans think that the government or the large actors should play a greater role. So in that sense, I would like to ask Ambassador Kim to answer first, and then we'll ask Maria. Okay, could you answer this question first?
네. 오늘
Yes. The questions at this conferences are at a very high level. They are posing very difficult questions. So first of all, what can individuals do? I would like to say that there are a lot of things individuals can do. In terms of reducing carbon emissions, how much impact can individuals have? So there are a lot of projections. By 2050, the 40% to 70% of carbon emissions that we reduce by 2050 can be achieved by changing the patterns of individuals or actions of individuals. So if all individuals work very hard to reduce carbon emissions, we can reduce the carbon emissions by 40% to 70% without further actions of governments and businesses. This reiterates that the changes in the patterns of individuals can play a great role. So for example, choosing train instead of plane, avoiding one-off goods, or saving electricity, or reducing wastes. These actions can contribute to reductions of emissions. And at the same time, as Professor Che mentioned, the role of individual, the role of government, the role of businesses, and also the interaction between these three parties are something that we should ponder often. So let me share some thoughts. So my conclusion is that the individual needs to voice out, and that will change the government and the businesses. So the people of the country must voice out in order to mobilize the government to change, in order for the companies to change. Consumers need to voice out in order to make business change the production pattern. If the individuals are not mobilized, the government, can they make policies? Can business change the way they operate to participate in climate actions? So without the individual's voice, individual's action, it is meaningless. So individuals need to proactively talk to the government through the voting rights, and consumers must require or demand companies to manufacture more eco-friendly way, and demand companies to reduce waste. And then the companies will change. When companies change from companies' point of view, they actually have to spend more money. They actually have to invest. If the consumers do not demand, companies do not have any reason to expand their investment in these eco-friendly ways. So I believe there are a lot of ways individuals can and contribute to reducing carbon emissions. There will be a lot of ways they can do by changing their attitudes, training their behaviors, and also the individuals can demand the government, demand the companies to act eco-friendly way. And I believe individuals have to pressure those parties. Thank you very much. I'd like to ask the same question to Maria. Dr.
I can only again echo Ambassador's comments, who have well explained the importance of the individual action and change. And this is why the planetary health framing is so important, is because it puts humans at the center, and it's our actions and our change in actions that will help decrease all the threats that comes to us. So that's one point. So it's important, as it's already been well ironed out by the Ambassador, to really educate yourselves about climate change and use your voice, as already described at the COP26, being the first time that MSF was actually an observer. It was impressive to see how many of the communities were actually representing and sharing their voice of concern. And I think it's important to add our voice to that, to change the policies that will protect planet Earth and keep it healthy. Another point I'd like to mention is, in a study of the Gallup surveys of the biggest, most respected voice around this are the medical forces, who actually see the health impacts directly in their emergency room, in their hospitals. And they need to be educated as well to understand how to make those links and speak around the health impacts of climate change and of environmental degradation that we do to ourselves. So pleading to medics to add their voice also and educate, and not just treat in their silos in the health structures, but rather also add their voice to the call for change. So I think I'll leave that in there. Thank you.
네, 두 분 답변 감사합니다.
Thank you very much for your answer.
기업과 정부의
The companies, the government, in order to pursue change, individuals have to speak up more, and we have to play a larger role. I think that was the point from both answers, and I do really agree with that. Now I would like to move on to the individual questions. We did receive such questions in advance. I would first like to ask Dr. Maria Guevara. So I think you have been active in the MSF programs since 10 years now. If you compare the programs at the MSF 10 years ago and the ones you have today, are there any meaningful changes due to issues on climate crisis? I would love if you could give us some examples or your insights into that matter.
It's very interesting questions, because that's also something that many in the movement is asking ourselves. What will it change if we put this on? But the thing is, we are always and have always been seeing infectious disease, emerging infectious diseases, managing malnutrition, etc. And addressing disaster response. The problem is that they are much more compounding on top of each other. They are actually more complex emergencies today, and that we need to be even smarter on how do we manage this. And we can, with the cascading effect of all these emergencies at once pushes us to our limits, and it's really hard to address what we were able to do perhaps in silo or alone. More often than not, we are in conflict settings, is probably not what's going to be in the future. That's one. And two, we are finding also emergencies, not only the usual humanitarian hotspots, obviously that is even worse than before, but we are seeing it in areas, in countries where we don't usually respond and provide humanitarian assistance. That's like the US or even in Europe. And what we see already, and COVID being one of those examples, is that this is going to be a future where there will be emergencies all around the world. And what will we do to manage that? And how will we be able to do this? We need to integrate that climate, the way we look at emergencies with the climate lens, and try to find adaptive responses to the operations to make us smarter. That can be anticipation, using predictive modeling, and targeting the most vulnerable, perhaps in an outbreak, and therefore we vaccinate more efficiently to those most affected. And the work that we've done, we're working with Health and Harmony, is probably one of the first and probably real Planetary Health NGO today, working to stabilize the forests, which are huge carbon sinks, and integrating healthcare around that concept of preserving forests. So we're trying to learn from that experience with them and working with indigenous population who are more often also the most vulnerable. Work like that we're trying to address because we are seeing, for example, malaria epidemics increasing in areas where we don't expect it to be, or increasing despite our interventions because of massive logging and deforestation, and therefore that environment is no longer providing a habitat where it's closed in general, and then the vectors are much smarter and bites much easier and lasts longer because their breeding season is longer. So these are starting to happen more and more, and we have to be conscious of that and put that in our thinking, in our operational designs. There are many more, and one example for it is that we're seeing also more heat wave related deaths, and we're trying to see how we answer to that, example in Pakistan, and how we prepare, imagine our emergency preparedness to ensure that we also empower the community to understand what emergency preparedness can be. The way we work in our offices in increasing hot weather will be an impact not only for the population, but for us as well as workers, and all of us will be affected. So we need to be smarter in how we protect our staff to be able to continue to provide care for those most vulnerable. I can go on, but I know that in the next session there will be more examples, so we'll leave that for then. Thank you.
네, 구에바라 박사님.
Thank you very much, Dr. Guevara, for that answer.
다음으로 이제 김용훈 대사님.
Next, I would like to ask my question to Ambassador Kim.
사전 질문입니다.
It was also a question that we received in advance.
탄소 중립 실현을 위해서 선진국과
In order to achieve global carbon neutrality, it seems that efforts from both developed and underdeveloped countries are required. The NDC, as you mentioned before, 137 countries have committed to their NDC. But I think the person who asked the question also knows that there are conflicting interests among the developed countries and developing countries. So for example, the US and China. In between such differing interests, how can countries come together to cooperate? I would like to ask your opinion, Ambassador Kim, on this matter.
네,
Yes.
화석연료는
Fossil fuel
기후변화의 주범인
is the main cause of global warming. In the past, was the basis of the industrialization period. At the end of 1800s, with the event of industrialization, the backbone of economic growth was fueled by fossil fuel. And now with climate change, we are faced with a situation that we need to reduce carbon emissions, which means essentially that we'll reduce our dependence on fossil fuels. And when we need to reduce our dependence on fossil fuel, that in turn means that we're changing the fundamentals of our economic operations. So for developing countries that have to pursue further industrialization and achieve economic growth, moving away from fossil fuel is indeed a big burden. Many developing countries, compared to countries that started industrialization earlier, like Western Europe and the US, are voicing complaints that the developed countries have enjoyed their period of growth based on fossil fuel, and they're just getting rid of the ladder for the developing countries to climb up for economic growth. That's understandable. However, climate crisis induced by climate change does not know and differentiate based on borders. Massive wildfires, hurricanes, severe weather events, and also, as Dr. Maria Guevara mentioned, infectious diseases do not know any borders. So, our response against climate change should not place focus on who was the main cause in the past. We have to come together with a future-oriented perspective on how we can work together to reduce impact from climate change. Common but differentiated responsibility was the previous approach, but emphasis now is on common, because everybody is responsible and everybody is accountable. We must all take on responsibility. Of course, the developing countries might feel that they are at a disadvantage, but they also have to think about 50 years from now, their future generation. They would also not want for their future generation to suffer from the effects of climate change and adverse impacts of global warming. How is it possible for us, the global community, to help the developing countries to reach economic growth without fossil fuel? That is the key question. Based on clean energy, even without emitting greenhouse gas. How is it possible that we can support them to achieve economic growth? Technology, the know-how must be shared so that they could improve their capabilities. And how fast we can do that, how well and effectively we can do that, is something that has been discussed in the circles of climate discussions at the UN. I'm actually an optimist in this matter. I think the response against climate change has to move away from who was more responsible in the past. And it's not only a matter of economic growth. It is a matter that all players must come together to cooperate for our future. Thank you very much for your answer, Ambassador Kim. Now, I would like to take some questions that we received live and to ask them on the audience's behalf. I think we just have about 5 minutes left, so please understand that I might not be able to ask all the questions. So on the heels of what Ambassador Kim just said, it's a follow-up question. At COP26, the funding, the support for developing countries that has been committed, is it being executed well? And is Korea actually contributing well to such funding? I would like to hear from Ambassador Kim. So yes, to keep my answer concise, developed countries from the year 2020 on an annual basis, it will be putting up 100 billion in funds, climate fund. But we fall short of reaching the 100 billion. So right now we're at about 80 billion or so. That's flowing from developed countries to developing countries. So we need, and there has been a lot of commitment, discussions at COP26 that such commitments have to be agreed upon and executed as soon as possible. But actually, a lot of the climate-induced disasters crisis we are seeing is not going to be solved by only this funding of 100 billion in the climate fund. It's not going to be enough from the government support alone. The private sector has to get involved. Companies, the private sector has to take more initiative and make more investments into eco-friendly business and establishing the infrastructure. That has been the key discourse among the global community. And many countries have been quite aggressive in making a lot of policies to support the establishment of such eco-friendly business infrastructure. Korea is not actually in a position that we have an obligation to help the developing countries, but we are voluntarily providing a lot of support. Korea has the Green Climate Fund, which is located in Songdo, and it is pledging 300 million in funding to that fund. And it is the second largest size in fund, just following Japan. And not only that, Korea has committed to increasing the green ODA continuously. We have the Green Growth Institute also in Korea that we are providing support to. And through many different channels, we are trying to support the eco-friendly business and the building of such infrastructure and programs from the Korean government side. Thank you for that answer. I think we have about 3 minutes or so. I think the remaining time I will use for Dr. Guevara. I think you mentioned that raising awareness on climate change is important, and it was mentioned also in your presentation. I think, as you mentioned, what could be, I guess, in terms of actions that are more direct in carrying out, why is improving awareness important? Raising awareness, is it actually more important than executing on actions? Is there a reason you think that this is more important?
It's not necessarily more important. It is just one of the 3 pillars that we are putting in place. Because what we do see, and as I've mentioned before, the emergencies of yesterday is not in the same intensity and severity and frequency as those of today. And we are already at our limits. And it's important that we ourselves raise our own awareness to the issue and educate ourselves in as much as we need to educate the reality on the ground for others to join in that response. And we need to learn together on this. And this is part of that raising awareness, is that as we build our analysis, as we build our experiences, as we realize more and more what it is that we're seeing at the field level, we have a duty, first of all, as part of a charter, to give witness to what we see on the ground and to highlight where those vulnerabilities are and where work needs to be. It's always been part of the work that we did. But it's even more important in this time because it affects us all. And we are all responsible. And somehow we need to understand that connections and link. And this is why the planetary health framing is important, because inherent in it is already this advocacy and understanding that the current human systems are failing, and we need to work together to fix that. The governance, the imaginations, the knowledge, we need to continue to build So awareness is a critical component of the adaptation mitigation. They should all be running in parallel. And this is why the call for that today, and why it's important to highlight it on Earth Day. But as I mentioned, it should be every day that we're highlighting this situation. Thank you.
네, 이제 마쳐야 되는 시간이
Thank you very
됐습니다.
much. This brings us to the end of session 1 panel discussion. Thank you so much for your insightful answers. We are celebrating and commemorating the Earth Day, and MSF Korea has prepared such a meaningful event. As Ambassador Kim has emphasized earlier, MSF is also participating in this effort to reduce carbon emissions, and MSF is at the front lines of the humanitarian crisis. I would like to thank MSF for their effort as well. Climate change is occurring slowly but surely, and MSF is providing medical help to those people in need. And I'd like to, I think it reiterated the roles MSF playing in these two areas. And I would like to thank everyone who paid attention to this session 1. So this is the end of panel discussion for session 1. Thank you, everyone.
네, 두 번째 세션을 시작하도록 하겠습니다.
Ladies and gentlemen, we will begin session 2. I'd like to thank Professor Che and also Maria Guevara and also Ambassador Kim for session 1. Once again, I'd like to introduce myself. My name is Taeun Kim, the Humanitarian Affairs Representative of MSF Korea. So in session 1, we heard from Ambassador Kim and Dr. Guevara on how planetary health links with humanitarian crisis. In session 2, we will hear from humanitarian organizations on how they work to mitigate the impacts of climate crisis and threats to planetary health. So we'll be able to listen to the actual cases on the field. We had 3 presenters in session 2. The first presenter is going to be presented by Monica Rowe. She is the medical director of MSF OCG. She will present on the adaptation of medical response in climate aid emergency. Director Rowe started her journey with MSF as a field activist in 2003. She worked in Geneva OCG as a program manager of many countries, including Kenya, Somalia, Myanmar, and Chad. Since 2019, she has been working as the International Medical Secretary of MSF. So during the presentations, if you have any questions, please leave your questions in the chat or in replies. And after all the 3 presentations have been delivered, we will answer the questions during the Q&A and panel discussion, but we won't be able to cover all the questions. So I'd like to invite Monica Rowe, who is presenting from Geneva early in the morning.
Voilà. Sorry for that. Can you see my slides? Okay, I cannot see anyone, so please let me know if you can hear me and see my slides.
Yes, we can see your slide.
Okay, sorry for that. So thank you very much for the invitation and for the inspiring discussion before. So I will try to guide you through a very short snapshot of what we are seeing as MSF in our projects in the field. So what I will be sharing with you is why do we care as MSF of Planetary Health in terms of climate change, environmental degradation, and loss of biodiversity, mainly because it has an impact in highly vulnerable populations that we are trying to assist, and what can we do about it and what we are doing about it. So what do we see? If you see this bunch of words, are the words that they are coming out when we do an analysis of all the interventions we have done in the past 10 years in MSF Switzerland, in the operational center, but it's a little bit more or less the same in all MSF. So we see a lot of infectious diseases like cholera, malaria, Ebola, dengue. We see malnutrition. We are responding to neglected tropical diseases, extreme weather events, and non-communicable diseases and insecurity. If we look in particular cases, what we see, for example, in Niger, is that if we compare the rainfall with the number of cases of malaria, what the teams are seeing in the field is that we are seeing more and more malaria. The malaria season is arriving earlier and is lasting longer. So that means that they see the change in the weather patterns, so in the rainy season, but it is ultimately linked to the climate change. That is the long-lasting effects of the weather changes. Another communicable disease that's also vector-transmitted disease. So as Maria was saying before, one of the direct impacts on climate change, environmental degradation, and loss of biodiversity is that diseases that they are transmitted by vectors, in this case mosquitoes, are exponentially, they are growing faster. Why? Because the vector, the mosquito, find much more environmentally friendly, the environment is more conducive to their breeding, therefore they are more mosquitoes, therefore they are more transmission. Another disease that they are vector transmitted, mosquito transmitted, is the dengue fever. This is the family of arbovirus. Maybe some of you have memories of the outbreaks we have of Zika and chikungunya. Dengue fever is one of those family of arboviruses that is very, very sensitive to climate change and weather patterns. So what we have seen in Honduras, in Central America, is that in 2020, the team was responding to the worst dengue epidemic in several decades afterwards of having 2 severe hurricanes back to back. So they were confronted to extreme weather events plus infectious diseases that they are both climate related. And then you have the perfect storm of everything together, and Somalia is a very good example of that. Somalia in the past 10 years have seen everything that can be seen, from high levels of food insecurity and malnutrition rates to disease outbreaks that they are related, they are environmentally sensitive, like cholera outbreaks. They have seen population displacement. They have seen flash floods. So because one of the things that we are seeing is that with the climate change, the certification is growing, but in certain areas of the world, what we see is changing of the rain patterns, and you have you have very heavy floods in a very dry soil that cannot absorb that extra rain. Therefore, you have the floods. So you have a crisis. The people is waiting the rain is coming, but it's either too early, either too heavy. It cannot be, the environment cannot cope with such a rain. Therefore, there are floods with the humanitarian consequences of displacement and potential outbreaks later on. And on top of that, in 2020 and 2021, as the rest of the world, there was the COVID pandemic. On top of that, a typhoon also affected Somalia. So jumping to what what can we do, or what are we seeing in MSF, how we are approaching this problem. This is a slightly different visualization that Maria shared with you. So the thing is that we get trapped a little bit in the concept. So mitigation, adaptation, education, but at the end of the day, everything is interlinked. So for mitigation measures is how to reduce emissions, what we are doing in MSF, and then later the Climate Action Accelerator, we do a little bit more of explaining how we reach that point. We are assessing where are we contributing the most and what measures we have to take to reduce. As was explained before, MSF has committed to reduce their emissions by 2030, but maintaining as well that our bottom line is that we need to still assist populations in distress. So we are adapting, we are mitigating, but not but maintaining the ability to respond. So what we are doing in mitigation is we are in the middle of the energy transition. So as the ambassador was saying before, we need to change from heavy fuel, for fossil fuel based energy in our projects to more renewable energy and clean energy. Again, this is not easy in many of the contexts where we work, where there are no roads. So we still may need a little bit of time, and we need to maintain some dependency of fossil fuels. But we are changing from generators based in building oil or fuel towards more solar panel generators for air condition and from providing energy. On top of that, we know that it's not only changing the energy, we need to change our behavior, and we need to reduce the amount of energy that is needed for deploying our activities. What we are doing in collaboration while doing the energy transition, we are doing a behavior change and education, and we are adapting our buildings to be less energy consuming. So we are investing in proper isolation. Again, that takes some time, but those are kind of the things that we are doing in mitigation. We are changing a little bit, and we are adapting a little bit our modus operandi with making sure that we are less reliant in plane cargos, for example, and making sure that our orders our medical orders and our logistic orders are done properly, and we can do by sea freight, because that will decrease quite a lot our contribution. And at the same time that we are thinking how differently we can do our medical action, such as we know, for example, in MSF Switzerland, that we are using plastic for in our medical consultations to give the drugs to the patients. So we are trying to reduce the plastic by looking for alternatives more eco-friendly, more environmental friendly to the plastic, with the same quality, because bottom line here is that we need to provide the quality drugs to our patients. So from mitigation to adaptation, there is this place that is, we are preparing for disruptions while reducing our footprint, and the adaptation is actually how we prepare ourselves to be faster, to be better, and as was mentioned before, to respond to the needs of a population that the climate emergency just add one more layer of stress to conflict, to poverty, to existing health conditions. So we are also investing and looking for how we can integrate the meteorological information that is out there, environmental, and mixing it with the reality in the field. For example, last year, we were using meteorological data in South Sudan to monitor the rains, because there was a big flooding in South Sudan. So we wanted to see where the rain are coming, to prepare ourselves, to alert the community, but also to preposition material and to react as soon as possible to potential outbreaks and health needs of the population. And at the same time, malaria, as I told you before, is a big problem, and it's increasing the numbers in areas where there was not before. So we are doing as well some research, merging historical data of malaria, climate data, and see if we can do we can create an algorithm as to predict how big is going to be the outbreak and how early we can intervene. So not waiting when the malaria cases are too high, but knowing when or where are going to happen, start making anticipatory measures such as vector control, alerting people, educating people about the use of mosquito nets, and so on and so forth. And all of this is by educating ourselves. So we need to learn, we need to keep on learning what are the consequences of the climate emergency in health. We need to articulate, we need to ensure that we are all conscious of what is happening and what will happen to the populations we are trying to serve. And through that, we need to raise awareness of what is happening in the field, because one of the risks that we have is that some of the hotspots are in very neglected areas. And they are in areas where investments are needed to do the energy transition for the country itself, to be less fuel resistant, fuel dependent, but as well where international companies are based that need to change the practices as well to not contribute to the environmental degradation. Because what we see now mostly is the direct consequences of climate change and weather pattern changes, but also of environmental degradation, of desertification, of pollution of water, which have a direct impact on the population. So, as Maria was saying, as a health organization, as a humanitarians, we cannot react, we cannot intervene in a way that is putting in harm's way the people in the future. So a part of doing the mitigation measures in the upstream globally, in every country where we are seeing that there is no action too small. So from making sure that we produce the less waste possible, that means how we are intervening. An example, gloves, they generate a lot of waste. We are now preparing a campaign to make sure that we use them wisely and not too much. Single-use medical material. In the last years, we have shifted from renewable material to single-use for many good reasons. But at the end, that generates a lot of waste that you need to treat. And you need to treat in conditions that they are not optimal. So you need to burn them. With that imply fuel, and that imply generating, potentially polluting the environment. So we are thinking on alternatives to single use. When do you need to use a material for only once? Is there an opportunity, and is there a chance? Can we see innovation in terms of, by maintaining the same quality and the same safety for patient and staff, changing our way of thinking that the one use is the golden standard, that maybe is not for everything. And then by doing that, then we can join our voice to organizations that they are, as Maria was saying, much more advanced, like Health Without Harm and Health in Harmony, and see, okay, we are doing it this way. And then is that possible to be scale up? Is that possible to be taken from others? So that's pretty much how we are doing it today. And I think I will leave it there, because if not, it can become a little bit too long. Thank you very much for your attention.
네, 모니카 국장님 정말 발표
Thank you very much, Director Roll, for your insightful presentation. We were able to take a look at MSF's activities and how the planetary health perspective is translated in the field. It was a very insightful presentation. So I'm working for MSF currently, and I meet the people on the feed. I learn new things. I think the presentation mentioned that it's important to educate the actors, and I believe so. And I personally feel that as well. It was a very interesting presentation. So now let's hear from another international humanitarian organization. You'll probably know this organization. This is a presentation was given by Save the Children. So the Save the Children has a team called DRR, Disaster Risk Reduction Team, and Manager Iji-san from this team will introduce you to the projects in Vietnam. So they do DRR, in other words, Disaster Risk Reduction Project, and also CCA projects, in other words, Climate Change Adaptation projects. And they are conducting various projects in Vietnam. And Iji-san, before managing this DRR project, she worked in Overseas Sponsorship Program and Overseas Health and Nutrition Program team. Please welcome Iji-san.
네, 안녕하세요. Save the Children.
Hello, everyone. I'm from Save the Children Korea. Iji-san, first of all, I'm very honored to present on our business at this opportunity. And I'd like to thank MSF for putting together such an amazing event. So 1 second. The Save the Children Korea, based on the crux of the importance of tackling climate change and humanitarian aid, we started this new project. So we have been running this new project in 2022 with the humanitarian team, and the climate change team has been put together as one team. So currently I'm working from that team as well. So we are working on providing more comprehensive aid to the people in need. So at today's Planetary Health Conference, I'd like to present on some of the climate change and humanitarian aid projects that we are providing. And I would like to share with you how all these come together. So this is the outline of my presentation today. They come in 6 parts. So I will introduce you to our business projects and how they have evolved into a climate change response project. And there are some, and then we'll show the project outline, and I would like to talk about how we moved on with the climate change, and we'll talk about some of the limitations we have experienced, and we would like to talk about recommendations and next steps. So I'd like to talk about the climate change impact in Vietnam first. So in 2019 Inform Index, out of 191 countries, Vietnam ranked 91 in terms of disaster risk levels. So it may not be able to understand. It may be a bit hard for you to understand when you think about Bangladesh, that it ranked number 1 in terms of exposure to flooding, and due to low territorial baseline and also the tropical cyclones are also posing great threat to Vietnam. So if we live in the city when we have cyclone, like, you might feel like it's not a huge threat. You can just be careful when you walk around the road. However, let's say, imagine if you're living near the Mekong River in Vietnam. If the same event happens, it doesn't just affect your life. It doesn't just affect whether you're convenient or not. It affects your life. And we provided this project in Mekong Delta region in Vietnam, in particular Cà Mau province. It is an important agricultural area, and it is vulnerable to natural disasters like saline intrusion, abnormal drought, irregular flooding, high tide, and cyclones. And it is affecting various livelihoods of people in the region. In particular, Kamau area that we are offering projects, it is facing various effects like increased temperature, flooding, inundation, and other impacts associated with extreme events. As you can see on the bottom of the slide, its risk to those impacts of extreme events are mid to high. So let's look into our project history. There are 5 phases in terms of our projects. The first 3 years, we received donation from KOICA, and it focused on humanitarian project context. It was a DR project in humanitarian project context, and it was short-term project. And from 2018, it was more mid-term projects, and our projects focused on DRR and CCA. And it had a development project context. Then how did these projects evolve into climate change related project? So this is a snapshot of how it has evolved. So in 2015, we focused on DRR and WASH, and the areas has been expanded to schools and also management of waste as well. So as you can see, the areas of project has expanded. In 2020, we also worked on improving the resilience of the community and helping them respond better. So let's look into the details of each project and to help you understand how they have evolved. First of all, let's look at the project outline of 2015's project. At that time, this is the background of the project. The Kamau area experienced 107 tornadoes, and it was greatly hit by the tornadoes. And 160 houses were completely destroyed and also claimed many lives. And we chose the community that was most hardly hit, and we worked on strengthening the DRR capacity of this area and also improve the community's resilience to disaster. And through this project, in the communities, we have improved their capacity to respond to a disaster. They were able to prepare and brace themselves for the next cyclone. And more than 14,000 people were benefited by this project. They have better access to clean water and hygiene latrine, and their resilience to disasters have been improved. The project was very short. It only lasted for 6 months. However, they had existing organizations, had existing groups. So we worked on improving the capacity and strengthening capacity. And we worked on selecting the appropriate watch projects. And I believe that it has laid a foundation for their long-term resilience to disaster. And through the projects, the projects were understood in a way that it was very effective. So we were able to continue with the follow-up projects. In 2016, the result of the cyclones that hit in the Q2 and Q3 of the previous year led to this new project. There is another issue. There was the dam that was built around the river, but because of the cyclone, they were broken down. So it had to be rebuilt. So during this 2016 project, there was some project focusing on schools as well, and we provided the WASH project as well. And the disasters caused by climate change were critical in this area. So we improved the capacity of students and the community as well. Through the project, 15,000 households received support, and through this, and it was in the similar context of the 2015 project. We believe that the families are better prepared to cope with natural disasters, and school children also have better knowledge on disaster plans through disaster simulations. So their knowledge has been improved and they have improved hygiene practices. Through 2016 project, we saw meaningful outcome. The families who received projects, so the cost that each household paid to buy water has been reduced by 50% by establishing how they, establishing the system they can reuse rainwater. And also this project is also along the line of 1002 policy and improve the RR capacity of the public officials and community. And also, so we worked in the context of the local policy. So we worked very hard to secure the sustainability of the project. And moving on to 2017, you will see that the project's focus has changed a little bit. So El Nino has become one of the reasons why the project has been taken into effect. So the project did not focus on particular issue, but it focused on the general impact of issues of climate change, for example, El Nino. And Kama was greatly hit by El Nino. And around that time, 10,800 households were affected by the El Nino, and the total damage was amounted to $45 million. And also they were experiencing prolonged water shortages, and they were experiencing higher rainfall than average. So when we were conducting feasibility tests to understand that need, the community were exposed to climate change, and we identified communities, people who are hotspots, and but at the same time have a great willingness to participate in the project. They were selected. So we conducted the capacity building. Another different thing to note is that it was the first time that we studied the environmental conditions, and our goal was to improve the waste issues that lies within household, and that was one different aspect compared to the previous projects. Through this project, we installed the flood-proof sanitary system, and through this we saw resilience. We saw the increase in resilience, and through the capacity building. So when the typhoon happened in 2017, the community was able to effectively respond to the cyclone, unlike before. And also, it was a pilot project in terms of setting up the sanitation system. And since it was fruitful, the local government noticed the benefits of the project. And from 2018, we offered the project with our own fund, and this area had the low access to water. They had water issues. There were 14,000 households that did not have access to sufficient fresh water, and they had to use the water from the well and aquifer to for their water consumption, and they were paying a lot amount to buy water that they need. And so our goal was to improve the DRI capacity of this community and help them improve their access to clean water and also create clean and safe school environments. And we were able to see some meaningful results through this project. So this time we were able to compare the before and after of the project. As you can see, the direct and indirect beneficiaries grew, and also you can see that the communities had better access to clean water after the project. So for the projects that needs immediate intervention, you cannot have enough time to do pre-research. But for mid to long-term projects like this, we had enough time to research before we actually start the project. And I believe that that is why we were able to bring more concrete results. And also during this project, we also emphasized the importance of managing and monitoring and evaluating the project. And now I'd like to move on and introduce you to 2020 to 2020 project, which is still in progress. This is also mid to long-term project. It's created a new impetus for us to start longer-term projects. As you can see, the budget has been doubled, and the project has been further evolved. And the CCA projects were applied to previous DRR projects. So we focus on disasters that are caused by climate change. We are conducting various activities, as I mentioned earlier. We are also included livelihood adaptation in this project. So climate change is affecting households and their livelihood. So the expected outcome is that the household will improve their resilience in terms of their livelihood. And this project is currently in progress, so we can't show you the results yet. But if we show you the first year's result, due to COVID-19, a lot of projects were delayed. However, we were able to provide support for 70% of the original beneficiary goal. And also, we strengthened early warning system and provided livelihood models. I'd like to add some more cases regarding livelihood support. So a lot of people in this area were working or relying on day labor, and due to flood, and as the flood or rainy season got prolonged, people who are making money on day labor could not maintain their livelihood. And also due to COVID-19, they were locked down in Kamo area, so they couldn't perform their daily work. And a lot of people had to rely on government fund or government subsidies. So when the natural disaster occurs, it is difficult to prepare for the disaster in advance. And once the natural disaster hits, it will be very hard to overcome. So we worked on providing livelihood or means to make a living despite the natural disasters. So in other words, we worked on improving the resilience of the livelihoods of the people. But despite the results that we have seen, there are some limitations to the project. As you can see from this map, each you will see that each project was performed in different areas, and you will probably guess what was the limitation. From the beginning of our project, it was based on donation that we received from the organization, and as you can see, the projects are isolated from each other. And from 2020 to 2022, although the projects were always there, the areas that received the benefit were not the same area. So as you can see, the projects are a bit disconnected. However, and also at the same time, if you look at the life of people in these areas from 2015 until now, the life patterns hasn't changed much. So here I'd like to highlight what other presenters have explained earlier. People here do not use separate toilets. They just defecate openly, or they use fish pond latrines and they defecate there. So even though there's a need to build separate hygiene toilet, but because of lack of finance or the differences in culture, it has been difficult. So we still need to work on changing the mindset or raising awareness. And due to financial issues, a lot of people are relying on the water from wells during dry season. So when we put those together, when the climate change and its impact is aggravated, their access to hygiene latrine will be even further threatened. And in order to protect them from climate change, in order to improve the adaptive capacity to climate change, we need to raise their awareness. Then, what would be the recommendation from us from these experience? So first of all, I think when we start projects, it is important to have mid to long-term vision. So as I mentioned earlier, we worked on different areas, and then it becomes very difficult to bring more long-term results, and also it is difficult to change the mindset of people. So when we start the project, it is important to have mid to long-term perspective. And for climate change project, I think it is important to do the research beforehand. What kind of impacts are they facing? What kind of projects would be needed? It requires some budget for it requires a budget beforehand as well. And also, so whether it be donor driven project or it's the NGO funded project, it is difficult to conduct the research beforehand. But more and more GCF and some other funds, they require you to the feasibility assessment before starting the project. And I think when we are developing climate change related projects, it is important to finish the feasibility assessment before embarking on a project. And as I also mentioned earlier, in order to evaluate the result of the project, you need to set clear and feasible goal and output indicators. And that has to be done during the planning phase. And also, if the local area does not have climate change data, say if we want to focus on improving the resilience, we need to discuss how we are going to evaluate the result. Is there any way we can gather data to help us make a decision? Lastly, climate change projects should be done in a cross-cutting manner. And I understand MSF is hosting climate change themed conference. So it should include environment experts, climate change experts from in and out of the organization. So in other words, first we need to plan the project with the mid to long-term perspective, and it requires budget from the early stage before even starting the projects. Without this pre-stage or pre-step, the actual project might face challenges. And this pre-assessment or feasibility assessment requires about 6 months. And also, if an organization decides to conduct climate change programs, I think you need to think strategically and plan this wisely. And Save the Children Korea's next steps are on this slide. And I'd like to wrap up my presentation with this slide. So part of the project that we conducted last year, so we have various other CCA projects planned. So we are studying the feasibility study in Indonesia, and we are going to plan a new project in Bangladesh. We are focusing on Asia because Save the Children Korea strategic area overlaps these areas. And also, these CCA projects are also a new project that we are conducting. So we chose the countries that we have interacted a lot. And based on the experiences we'll build up, we are planning to expand the projects to other areas as well. And we want to work on diversifying project funding source. Save the Children for the first time accredited by GCF. And we have created a group, and there are 5 members preparing for the proposals. Save the Children Korea is specialized and is preparing for CCA projects, and among the CCA projects, there are hygiene, public health, and livelihood enhancement projects. For Indonesian project, Save the Children Korea is leading the development of the concept note, and we are working on this currently. And also, the Save the Children Indonesia project also has a focus on providing medical support as well. So, and also we are considering corporate donors. So with the ESG movement, Save the Children Korea is looking for various business donors to cooperate on environment and social theme. So with Hyundai Motor, we will start project in Indonesia regarding waste recycling. If you have any questions during a Q&A session, or you can email me if you have further questions, and I will get back to you. Thank you very much.
네, 이지선 매니저님 대단히 감사합니다.
Thank you very much, Jason. Save the Children is putting a lot of thought into a lot of the programs, projects that you're carrying out. You talked about how the lack of integration could have been an area that you could improve, but I think it was very inspired by how the efforts you were making to make things better in terms of your efforts moving forward, and also how the involvement of experts from climate change and also health are important, and their voices should be reflected into the future programs. At the MSF, we also have a lot of experts advising us on climate change, and we have such colleagues joining us to provide such insight. I think for other organizations, this should be also a best practice to follow. Now, I think we can move on to the third presentation. It is our last presentation for the day. I think a lot of the people listening today would be able to relate to what is going to be presented, and a lot of actions that could be taken in consideration that you could implement into your programs and future efforts. If you have any questions, please post them in the chat. I think I did take a peek, and there are a lot of people who are just posting their review of the session and what's being discussed, and I think that's very interesting, and I encourage that to keep coming. Okay, so allow me to introduce our last presenter. We have the founder and director of Climate Action Accelerator, Director Bruno Jokum. It is a nonprofit organization leading discussions on climate changes from various perspectives, including medicine, health, research, and training. And also it provides many solutions for climate action. It was founded in 2020 by Director Bruno Jokum, and it is based in Geneva. And actually, Director Bruno has been working in emergency medical relief projects for the past 20 years. He has very close ties with the MSF, previously serving as the program manager and the director general of the operations center in Geneva. So he is very close to MSF. And today he will give us a presentation on the best practices of climate emergency solutions supported by Climate Action Accelerator. It could be quite new, the organization, to the participants from Korea, but you are going to show us a lot of the cases from Alima that the Climate Action Accelerator pursued. Thank you. Now let me invite Director Bruno. Dr. Bruno, you're on mute.
Do you hear me now?
Yes.
Okay. So many thanks for inviting me to this conference. I'm very honored to be part of the panel of speakers. I'm going to present you the Climate Action Accelerator initiative and focus on the experience we gathered with the first organizations we're working with, notably ALIMA, which is the Alliance for International Medical Action. But we're also working currently very closely with Médecins Sans Frontières, and notably Geneva, but also Paris and Brussels. And I'll finish this presentation with a few words on how to amplify the action at the level of the sector. So a few thoughts to share with you. I'll be focusing here on reduction of emissions because this is the main area where we work today. So first, just one word about the situation we're in. I think sometimes visuals summarize more eloquently the situation than many words. And I think this visual shows exactly the crossroads we're in. The trajectory on the top is the trajectory we're following today. So the global warming is going to accelerate considerably in the years to come. And we're likely to be at 1.5 degrees already in the 2030s, at 2 degrees already in the 2050s, and we're still on track to go beyond 3 degrees by the 2070s and onwards. So the situation is urgent, it's dramatic, and the whole issue is how to go back to stabilize the situation with the trajectory that is below, which will not avoid a certain level of warming, as you all know, but which can at least stabilize the situation. And of course, I would say the less mitigation there is, the more adaptation will be needed. And both are critical, but obviously the two are very much interrelated. Now, who are we? The Climate Action Accelerator, we're a non-for-profit initiative, and our main goal is basically to mobilize a critical mass of non-for-profit organizations to scale up solutions, and especially in the aid sector in priority, but also with the aim of having health actors and higher education actors coming on board of this initiative. And the whole question is how to, I would say, help with a radical transformation of practices to be up to the challenge, which is the same challenge as for the rest of society. It's no different. Our objectives, the way we want to get there is with 3 objectives. One is how to make it possible, and therefore working with organizations to empower them on how to at least halve emissions by 2030. And this is about bringing together resources, constructing plans, etc., with organizations. It's how to turn them into vectors of change that are influential within their networks, to bring more organizations on board and to influence their ecosystems. And it's also how to build a community of practice which is sharing, climate solutions and experiences as a common good, so that they're easily accessible, and this is very much a factor of acceleration. Now, as I said, our first priority is working with the aid sector, and this is where we are currently active. I'll say a bit more just after. But we also are working on bringing a number of health institutions which are not part of the aid community on board, because there's a lot of, I would say, experience, but also challenges to be faced, and universities. So it's very much, I would say, a cross-sectoral initiative. We currently have 15 aid organizations that have joined the accelerator and that have taken strong commitments, and Médecins Sans Frontières is one of them. Committing to science-based reduction of emissions, halving by 2050. And among our partners, we have, I would say, both very large players like the International Committee of the Red Cross, Médecins Sans Frontières, but we also have smaller players from different countries. And we're currently a partner of the UN Framework Convention on Climate Change campaign, which is Race to Zero, which is focusing on mobilizing different sectors of society towards a rapid reduction of their emissions. Now, I'm going to share what the main learnings are of our first works, notably with ALIMA, the Alliance for International Medical Action, which is based mainly in Western Africa, with a headquarters in Dakar, but also in Paris. And I think what's interesting with this first experience is there are many lessons for other organizations also. So the roadmap was built on a few key principles, which are important, which is integrity, of course. There's a lot of debates on ecological claims which are not necessarily founded, on carbon neutrality. Here we're talking about an approach of integrity. This is not about buying carbon credits to make people believe an organization is neutral. It's about following absolute reduction pathways that lead to the right targets, basically. There's also a principle of humility. There are things that are known, which can be deployed, which can be expanded, and there are challenges that have to be overcome. So not all is known, but it's by confronting the problem that you actually build the experience and make it happen. Acting needs mobilization of resources, clearly, human, technical, financial. And so here, this is not about general commitments, it's all intentions. It's about actually planning also the resources that are necessary to make it happen. And last but not least, as Monica also mentioned in her presentation, the whole question is how to reduce the footprint radically, but while not compromising the social mission goals of the organization. This is about continuing to deliver assistance in a world where the needs are going to become higher. And this is the pathway we have to build together. So if we look at the footprint of an organization like ALIMA, which is, I would say, an average medical humanitarian organization, well, what do we see? What do we see is, well, maybe first, the emissions are relatively significant. Huh? An organization of about, it has a budget of about 60 million euros. The emissions are estimated to be almost 15,000 tons per year. We're talking about the emissions of, I would say, a medium-sized company. And when we look at ICRC's footprint, it's beyond 1 million tons per year. We're talking about the emissions of a large company. So aid organizations are not very different to, I would say, business companies and their emissions. And simply why? Because they need resources to function and to deliver their mission and to deploy around the world. So that's the first lesson. Second is, despite the COVID pandemic, if we take the organization of ALIMA, they actually increased their emissions in 2020, despite less travel. Why? Because their activities are expanding. And I think here the message is that most dynamic organizations are actually constantly expanding their emissions. This is, despite the climate crisis, this is the reality we're in collectively. Third lesson is that, well, energy, you know, whether it's electricity, whether it's fuel, is an important contributor, obviously. But the direct emissions linked to this are relatively, represent hardly more than 20%. The rest is two other very big sources. It's what you see in yellow, it's the supply chain, it's everything an organization buys, whether it's goods, services, and then it's what you see in green, which is transport. So it's everything an organization organizes in terms of, you know, traveling of people, whether it's by air or by road, and it's transporting goods by freight. Now, with ALIMA, we did a number of working sessions together to identify a number of solutions in each area, whether it's transport, whether it's procurement, whether it's energy and buildings, waste, ecosystems, digital, etc. And we looked not only at solutions which decarbonize activities, but also at solutions that actually reduce the environmental footprint of local projects, as we all know. So it is about a holistic approach and not just focusing on carbon. What's interesting in these solutions is that when we look at the trajectory of the organization, so this is a graph which represents the evolution of emissions, carbon emissions, that would happen if basically nothing was done, business as usual. Okay, this is the top black line you see, and it confirms that very likely, if nothing was done, ALIMA, as a growing organization, would have a constant increase of emissions over the next decade. And the whole challenge is how to bring this curve down to a reduction target, which is 50% of a baseline, which here is 2020, and how to identify the big levers that are going to allow to reach this trajectory. And so what is very clear in building this trajectory is that although 20 solutions were identified, actually 5 solutions make out more than 85% of the impact over 10 years, which is actually quite good news, because it means that when you're managing an organization, you actually can focus on a limited number of levers if you really want to have an impact. And what are these key levers? Well, I mean, there's no surprise about what they are. It's basically reducing air freight to favor maritime freight when you displace important quantities of goods to the areas where you're acting. It's rationalizing staff travel. It doesn't mean eliminating staff travel, it means rationalizing, especially air travel, but it's also about the energy efficiency of vehicles, the type of vehicles that are bought, how fuel is consumed, etc. More critically, it's actually environmental criteria that to guide purchasing of goods and services. This is almost half of the effort. And basically organizations are mass consumers. They're not producers, they're not fabricating the goods, etc. They're consumers, and through their choices, they can actually accelerate the reduction of emissions in society. And finally, it's the switch to renewable energy, and notably solar energy in I would say less developed contexts where you don't necessarily have an electricity grid available. Now, when we look at the means that are necessary to actually implement such roadmaps, the first, I would say, what's important here is to have measurement systems to be able to measure progress. It's important to integrate a number of key, I would say, human resource responsibilities. This can mean distributing responsibilities differently. It can mean also creating positions to actually support the ambition. And it's also a lot of training. There's a lot to do in terms of bringing human competence at a different level on this issue. But perhaps more interestingly for many organizations is that when we looked at the financial impacts over the first 3 to 4 years, what we saw for an organization like Lima is that actually the savings compensated the investments. And it's too early to say whether this can be generalized to every organization. There has to be more work done, but it is I would say an important lesson. It means it's a lot about reallocation of resources, and of course, depending on the specificities of each organization, it can be more or less extra investment. So what are the key learnings in the end around this exercise that is currently being done with 15 other organizations? Is first, there are significant internal levers to reduce footprint. So what's coming from outside the organization is important, but it's actually less important than the internal levers. Second, it's important to focus on fewer solutions that have greatest impact rather than, I would say, disperse the energy of the organization into hundreds of small solutions which are very difficult to follow. So narrowing down to the essential solutions is critical. Third, you need leadership, political leadership in the organization, and investment in people are the real key to success, more than funding. Fourth lesson, it's important to have a quantified approach. I mean, it will not be enough to have, I would say, general goals, general objectives, because there's very little chance that this will change the picture. What you need is quantified indicators per each solution, each area of action, and you need intermediary milestones. It's probably the only way of actually having, I would say, a serious impact by 2030 and beyond. And finally, you need agility. When we're talking about roadmaps over periods of 10 years, you need place for continuous learning, you need place for adjustment, so you need adaptive strategies. Now, beyond Alima, as I said, we're currently doing this effort with actually 15 organizations that have come on board currently. They're starting at different moments. But as you see, so we're doing important work currently with Médecins Sans Frontières, Geneva, the International Committee of the Red Cross, but also the Terre des Hommes movement. And we are having an increasing number of extra organizations joining. We hope to be around 25 by the end of the year, by end of December. And maybe what's important is to, I would say, because of the weight of the ICRC, of the MSF movement, but also Terre des Hommes and others, this actually represents already between 10 and 12% of the global humanitarian budget. So it's actually relatively significant. And we hope to be able to mobilize hopefully around a quarter of the global humanitarian budget in this initiative. Now, when it comes to amplification, what do we have in mind? Because of course, the whole point in this approach is how, with, I would say, concrete experiences and partnerships with key organizations, is how also to, I would say, extract generic lessons that can be useful to everybody, you know? And in order to make the sector tip. You know? So we have, for this approach, I would say 4 key areas. One is mobilization, as I've already said, but we also will be starting to focus, especially next year in 2023, on having more national actors join the movement. Not only international actors, but key national actors, because they do a big part of the work, if not most, in many, many contexts. We're also collaborating with the Red Cross movement, notably with the links with the Charter, which has been signed up by 200 organizations. And we're collaborating with the Race to Zero of the UN Framework Convention on Climate Change. Now, in terms of the second area is about mutualized operational support, so action plans, but also looking at the specific challenge of what does it mean for non-for-profit organizations in developing countries, because obviously it cannot be the same objectives. It's more about how to reach, I would say, a decarbonated development model, which is also making space for adaptation and resilience. And as it was said by previous speakers, a lot of the solutions actually address the 3 challenges together. So it's not as if these are silos. Finally, tools to accelerate sector-wide transformation. So this is important. We're currently working on an inventory of solutions that will be made public. We're also collaborating with the ICRC on a carbon accounting tool for the humanitarian sector, and notably contributing to the first pilots. So this is about having tools that help organizations that are more adapted to their areas of intervention and context. But we also have in our plans for the end of 2023 to actually produce a generic roadmap for aid organizations. So extracting lessons from the first 15 organizations to actually publish a generic roadmap which can help different organizations even when they are not partners to the initiative. And finally, amplification is also about how to make the shift bigger, to scale up. So obviously a community of sharing is important in this way, making things available. So is actually training, transfer of knowledge and experiences. But we are definitely committed to establish, I would say, a dialogue with key institutional funders, whether it's states, whether it's public agencies, foundations, on how to influence their policies so that basically they enable the transformation of the sector in a better way. A lot of organizations are very dependent on these funds, and depending on the rules of the game, it can actually either favor acceleration or actually hamper it. And this should be done while, of course, strengthening the goals of humanitarian assistance for vulnerable populations. So I'll stop there, and many thanks for your attention.
네, 조금 총장님 정말
Thank you so much, Director Jokum, for your presentation. So we talk about how to respond to climate change. We talk about we should engage in climate action, but at the same time, we feel like we do not know what we can practically do. So by listening to the presenters today, we were able to get detailed ideas. I started in 2020. Seems like Director Jokum's started in 2020, and it already grew so much, and seems like it's working with many organizations already. So from now for 30 minutes, we would like to invite everyone. We would like to invite the presenters and talk and engage in panel discussion. Due to time constraint, we can't cover all the questions we have received. And also these videos will be shared on our channel on YouTube, so you'll be able to contact the emails of our presenters. You can double check that on the videos. So if you still have further questions, feel free to contact our presenters. Thank you so much. So I'd like to ask the questions for all three of you. And all three of you have various experiences on the field. And I'd like to ask you if you have felt the climate crisis in the field, and what were the most memorable climate crisis and or planetary health crisis that you have experienced. If you can share based on your personal experience, that would be helpful. I will start with Director Monica Roll and Jisun E, and then Director Jokum. So Monica Roll.
Thank you very much for the question. That's a difficult one, because again, I think that one of the issues that we are seeing here is that we need to stop trying to make a direct link between the climate emergency and a particular event on the field, because that's what gets us lost. And because people want to have that link, then we have a difficulty to say, no, what we are seeing is a worsening of a situation that was already a disaster before. And to all the hassles and all the stress that population has, you now add a climate emergency on top of that. With those lenses, but I know that we are talking about the direct consequences of climate, I would say that I have the most recent experience probably will be the two cyclones in Mozambique a couple of years ago that hit the coast of Mozambique with a heavy destruction and population movement, and being compounded as well with a cholera outbreak. So you saw an area that was already suffering through a humanitarian crisis in the north in Cabo Delgado province, through a dual pandemic and epidemic of HIV and TB in the coast of Beira, and on top of that you got some economic crisis due to other factors, and then an extreme weather event, a disaster hit. So that just destroyed the little that they had. And as our colleague from Save the Children says, sorry, your name is very difficult, Jinsung, is that the population needed to react to all the different stressors. So the people was trying to look for a shelter, trying to look for clean water, trying not to pollute the water with difficult access to sanitation, and on top of that, a cholera outbreak that was in the mix. So I think that shows us how important is that we all work together. So you need to move people to safety, you need to give them a proper shelter to try to avoid an outbreak that is related to those difficult living conditions. Thank you.
네, 감사합니다. 사실 굉장히
Thank you so much. But I think Director Monica Roll pointed out the most important crux of the issue. So if we only look at problems one by one. We won't be able to get the whole picture, but from the humanitarian perspective, the climate crisis can become a humanitarian issue and it can become a poverty issue. They all encompasses one thing. So now moving on to Jisan E. So in the field that we're working, we have to consider climate change. We cannot ignore it anymore. And as Director Monica Roll has mentioned, the humanitarian support are needed in the disaster-stricken area. So from a person working from Korea, donor country, I also experienced the climate crisis as well. So in Korea, there are various people, there are various staff working in Korean offices, and even without like hard monitoring very hard, we already seeing the differences. For example, so the flood has occurred, and because of the flood, and the moms and children, they cannot access medical aid, and we are seeing that. And also in our overseas sponsorship projects, if there's a prolonged drought, the parents cannot make a living by farming, and then they have to move to urban areas to get another job. Then they no longer benefit from children donorship. So we see that. And also the rainy season and the dry season pattern changes due to climate change, and some of the projects are affected. So from an activist point of view or field worker point of view, the project schedule or the budgeting need to consider climate change. And it's not just in the field, it's also from the back office point of view, for example, in Korea. And also climate change is aggravating natural disasters. A lot of presenters mentioned about cyclone. And there was an area that we only worked on cyclones, and a few years later, due to climate change, we have to work on drought all of a sudden. So climate change is closely related to our field, and it requires various responses. And we are feeling the impact of climate change in this way. Thank you so much, Manager Ji-sun-Lee. She also touched upon various elements from the perspective back office in Korea. So I'd like to ask the same question to Bruno Jokum, our Director Jokum.
Yes. So I think it's always very hard to attribute a single event to global warming or climate change because it's obviously always multifactorial. But having said this, it's, I think, very clear the trend of increasing frequency and intensity, especially of extreme events. That's one thing. And then a very slow degradation, which is very progressive, of the environment of many societies that are more exposed, and especially in the tropical areas, but not only. I mean, just to give you an idea of what's happening in sub-Saharan Africa, the Sahelian belt has already warmed by 1.5 to 2 degrees since over the last century. The expectation is that there's going to be an additional 2 degrees by 2050, so in the next 30 years. And this comes on top of already high temperatures, desertification, violent rains, because it doesn't necessarily mean there's going to be less rains, but more violent with more impact. So, I mean, people who live in these societies are speaking about this constantly. They know very well there's a degradation of their local environment.
비슷한 답변을 주셨는데요. 저희가
Thank you, Director Jokum. It was also along the same line. So we have to look look at the context, how the particular area has been experiencing poverty issues, of environmental degradation issues, and looking at it from an overall perspective will help us in establishing our climate action. Now I'd like to ask questions to individual presenters. Our first question goes to Director Monica, and waterborne diseases are mentioned often because it's growing due to climate change. Is there any preventative measures to reduce waterborne disease other than educating hygiene? Is there any other areas that we can work on in order to reduce the impact of waterborne diseases?
Well, that's a very interesting and very good question. Yes, waterborne diseases are one of the main infectious diseases that they are very much weather and environmental related. There are different types of waterborne diseases, and the most, I must admit that if we want to fight against them, is sanitation, sanitation, sanitation. I mean, there is no silver bullet, there is no vaccine, there is no, you can use the cholera vaccine in an outbreak or in an endemic area that will reduce the possibility of disease. But if you want to actually control, you need to provide access to clean water and proper sanitation measures to the people. However, this said, when there is a problem of waterborne diseases, if the environment has changed, education is important. Knowing what is the methods of transmission can protect the people. And at the end, what you want is to empower individuals to be able to cope with the environment as it is. And if the sanitation cannot be improved, and again, a call for investment in sanitation, it's super important. WASH is the future if we want to address climate consequences. If you cannot do that immediately, at least the people need to know to limit exposure and how to behave. We can always, and again, that's an important thing, we have now easy technology to actually clean water, and it can be at household level. You can use solar panels to create chlorine at household level, and then you can have clean water and safe water in your house, even in the middle of a natural disaster. So I would say prevention is important, education is important, and then vaccination programs are important for those diseases that they are vaccine preventable. Thank you.
네, 모니카 박사님 감사합니다.
Thank you very much, Dr. Monica, for your answer. I think training on sanitation, as you mentioned, it's always an area that we cannot emphasize enough. I think, of course, for us, our workers that are working in the field at MSF, we do carry out a lot of promotional training on education for sanitation. But I think also not only the nurses and doctors, but also other actors can take part actively in raising awareness on sanitation and carry out such training that is so critical for the prevention of such diseases. And the next question will go to Manager Chi-Sun Lee. So for the DRR, CCA projects that were mentioned in your presentation, what would be the prime area of focus among these programs? Are there any programs that were carried out regarding biodiversity? I think probably this is a question raised by a student studying biodiversity. I would ask for your answer.
Okay, so I briefly mentioned in my presentation, so when we run CCA project, it is important to understand what the areas are, how the areas are affected by the climate change. It is very important. Maybe we have the national level data or regional level data. However, for NGOs, when we perform our projects, we need information about more sub area. So for example, is that community experiencing impacts of sea level rise, or there are no documentation that are available at that level. So, for example, due to saline intrusion, let's say they were able to, their harvest of particular crop has decreased. So what kind of crops are more suitable for the changes in the saline level of the soil? And also we should look into who are most impacted by the saline intrusion. And it is, so we need to look at like who affected the most, and it requires scientific research. So before we start project, we will form expert group who can consult on the project, and that project, the consultation team would include environment expert, also have agricultural expert. Those team will have experts in the area and they will conduct the research. And through this research, what we want to find out is that which group of people are most impacted by that climate change, because only then we will be able to design the CCA project to help them out. So when you are designing CCA, that research that is conducted before the actual project is important. And also regarding DRR or CCA projects, it's impossible to have all the experts in-house. So for example, regarding biodiversity, if we are to conduct projects on biodiversity, and we want to learn about how we can improve or preserve biodiversity, if that is deemed to be the most important issue for that community, then since Save the Children focuses on children, we do not have experts in-house. In those cases, we will partner with universities or the institutions who are specializing in biodiversity. So currently, I did look into some biodiversity projects in Save the Children's projects, and the Bangladesh has some biodiversity issues, and there was another project with the Rohingya people to improve the biodiversity. There was some environment that were degraded by using the resources in the area too much. So if biodiversity is deemed to be the most critical issue in the area, then we will look into it. However, we are not the best people who can do biodiversity work, then we'll partner with them. I see. Thank you very much. It was a difficult question, but thank you so much for your insightful answer. So in the field, a lot of work are conducted in collaboration. Some NGOs focuses on biodiversity, some focuses on children. So on the field, I think this collaboration between the organizations will be very important. We look forward to see more collaborations among NGOs. The third question goes to Director Jokum. So in order to so cooperating with countries or government is essential in climate crisis response. Are there any detailed plans to cooperate from your organization point of view? Director Jokun, you mentioned that you will expand your cooperation with the government. So I would like to know if you have any plans.
Yes, so the way we want to approach governments for the aid sector is really through the funding and programming policies. And it's really about, I would say, sharing the lessons that are coming from our experience with different organizations to see where are the action points or where are the bottlenecks which need to be, I would say, worked on to create an enabling environment. So that's going to be our main priority. We focus purposefully on organizations today. It's a conscious choice, because most of the climate action is taking place actually at policy level and at, I would say, citizen level. The wide majority of companies, organizations, whether public, non-for-profit, etc., are today not planning a rapid reduction of their emissions. You have some, I would say, a few which are standing, in front and trying to do things, and MSF is one of them, but they don't represent the wide majority. And I would say the whole challenge is really, from our point of view, it's how to create a domino effect within certain sectors of society through exemplary action. So policy has to be influenced, but we're now facing an emergency, and what counts the most is action plans at all levels of society. And so every stakeholder needs to work on what levers they have.
네, 총장님 좋은 말씀 감사합니다.
Thank you very much for your answer. I think, as you mentioned in your answer, the domino effect was quite catching, because I think a lot of the organizations are looking and referencing each other, and if they see a positive outcome, I think it could be constituted as following someone, but still, if it's in a positive way, it could create best practices, and it could further facilitate the development that's required. And I would like to move on to some individual questions as well. I think there are some questions that are posted through the live chat, and we have one for Director Dr. Monica. MSF has worked on not only planetary issues, but a lot of issues regarding climate change. I think there's a limitation of resources. How do you work on allocation of resources among such limitations? Do you have a certain approach that you use?
First come, first serve. No, I'm joking. Yes, the thing is, and that was one of the internal fights in MSF for a long time. We have limited resources. Do we put them in being environmentally responsible? Do we put them in treating people today? Thanks God we passed that. And now it's like you cannot do one without the other. So what we are doing is investing smartly in a way. We have as well a part of our partnering with organizations like the one of Bruno, the Climate Accelerator. We are in discussions with the Climate Center in the Federation not to duplicate efforts. And we have invested heavily in MSF in a transformational fund that teach us how to do things smartly, and it's called the Climate Smart. So as Bruno was saying, we already have some solutions that we can plug in that they are going to be cost efficient, and even if it requires a little bit of investment forehand, it will pay off in a few years. So how we organize our money? What we do is we see on the needs. We see who is in need. We plan our years, and as Jansun was saying, we have kind of a budget plan for 3 years for already known emergencies that we integrate the climate lenses on those, and then we have a significant chunk of money that is non-allocated. And that's what the generosity of governments, foundations, and individual donors give us to actually put the money where the need is. So we can play with that in a sense that we are responding to an emergency, maybe a little bit more costly than other people because we are integrated. We are integrated to do it in a more sustainable, environmentally sustainable way. So I think we are one of the privileged and I know that Save the Children and other organizations that Bruno was mentioning are very heavily reliant on donors, and donors look the cost per patient, not the impact of a slightly more expensive approach. In MSF, thanks for the generosity of people that trust us, that doesn't put, okay, you must use this money for this. We can, as Bruno was saying, we can start trying new things, doing solar water pumps, doing isolation in buildings that probably other organizations have a tough time to do. So it's also a call for donors to actually think bigger. And it's not only how much it costs a product, it's how much benefit on top of treating people or saving people today it will have in the long term. Thanks.
네, 모니카 박사님 답변 정말 감사드립니다.
Thank you very much, Monica, for your answer. I think, as you mentioned, a lot of concerns on cost effectiveness and the prediction on fund allocation are very important points. As we are an organization that has to be politically neutral in terms of our stance, we do have a lot of individual donors. Of course, such kind of targeted donations are important, but I think also the consideration of how a lot of the funds can be allocated effectively for a broader purpose, and the communication is an important aspect in winning over the people who are making such donations. And if for climate change, I think there was mention of such funds and the work that MSF is doing. If you are curious to find out more, please search it up on the web and you would be able to find a lot of information. I think we also have a question for Ji-sun Lee.
있는 개념이어서 제가 설명을 드릴
So
건데요.
I'm going to explain a bit more about the questions that we received. So among climate-related projects in Save the Children, are there any examples that reflect humanitarian development and peace nexus? So this humanitarian development and peace nexus, if you are in this humanitarian field, you would be aware of this new idea. But for those who are not, this would be new. This won't be new, but there can be some participants who are not aware of it. So this is sometimes called triple nexus because it includes humanitarian development and peace nexus. This is led by UN, and there are a lot of needs in these countries that are in need. And in the end, the purpose, all the projects that we do, it should have an ultimate goal of bringing peace to that area. That's the crux of this humanitarian development peace nexus. So a lot of organizations are adopting this triple nexus, and it became mainstream. So the question is that, are there any examples that reflect the triple nexus among Save the Children's climate change projects? It was a lot of there were a lot of difficult questions. So in our CCA team, we did not have triple nexus in designing. However, after our team was combined with humanitarian team, we started to include this nexus. So for example, in Uganda, there is a project focusing on refugees and improving the health of the moms and young children there. And regarding this, so we have a lot of HDP nexus related materials in Save the Children now. But when the Uganda project was designing, it was still in the initial stage. So we looked at the project, and so it's not just focusing on humanitarian and development focus, and it also aims to achieve peace. And it's been a couple of years since this project has been conducted. Let's say if the refugee number of refugees increases, it could create some tension between refugee groups and the host country's people. So instead of just providing the support only for refugees, this support is also provided to host countries' people as well. So the 70% goes to refugees and 30% goes to the community for the sustainability reason. So we are linking the service with the local service. So I think this will be a good example of reflecting HDP nexus. And UNFP, SCK, and IOMING Burkina Faso Peace Project. This is also reflecting HDP nexus, and we will be able to see how this is applied in the field. In 2021, December, KCOC and the civil society got together and to deliberate on HDP nexus. And in this research, Save the Children also participated in this research. If you're interested, you can look up and you'll be able to see more articles about it. And if you have more questions, please contact us. Thank you, Ji-san-Yi. So I think you have mentioned a very important materials that we can use in Korea. This nexus concept is not complete, and it is difficult to say when it will be completed. However, there are many efforts to reflect this triple nexus in their work, and Save the Children seems to be working very hard to apply this nexus in their work as well. So if you are curious about triple nexus, please look up the materials mentioned by Ji-san-Yi, and I think you can further think about it. So I would like to give the question to Director Jokum.
So from the Climate Action Accelerator, are there any specific training programs that you have developed and are carrying out specifically? The staff, the colleagues that you are working with, are there any special actions that you take that differs from other organizations?
So trainings is part of our plan. They're not yet available because we as I said previously, we want to extract lessons of different roadmaps first before producing the training material. But this should be available by the end of the year, the first trainings. That's what we're planning for. What we are organizing, for example, in West Africa with Alima for this year, is a number of workshops with national NGOs, where there will be, I would say, sharing of experience, consultations with these national actors, and transfer of knowledge also. So these first workshops are going to happen in June, and then in 2 countries, and then 2 others in September, October. We are also planning an online event, which will happen from Geneva in September, where there will be lots of invitations shared for people who are interested. And finally, if I may, our digital platform is in the final stages and should be open to the public the last week of May, which is in about 1 month.
네, 총장님 감사합니다.
Thank you very much, Director Bruno. The organization you've founded, I think, might have been quite new to participants from Korea, but I think it was a great opportunity for us to get acquainted with the work you do. And I hope and believe that the works and the plans you have ahead will be executed to the best extent, and it will serve as a great reference. I think a lot of the people looking at your presentation, I think even through SNS like LinkedIn, will be very interested to be kept up to date on the developments carried out through the workshops, and also looking forward to future opportunities for working with you. think today, that concludes today's conference hosted by MSF Korea. I would like to offer my sincere appreciation for all the participants for the great questions and all the presenters who joined us from all over the world, from Korea to Geneva, and Geneva very early in the morning. Special appreciation to come together to share their knowledge and experiences on planetary health and the climate emergency. I extend my sincere appreciation to you all. If there are any other questions you have regarding MSF, or if you want to learn more about our activities and operations, please visit our website, msf.or.kr. If you did not yet participate in the survey, please take your time to do so through the QR code or link available on the screen. Moving forward, I ask for your continued interest and support for MSF activities ahead. I think for my last comment, I will make both in Korean and English myself.
Let me briefly have closing comments in both English and Korean. We easily tend to prescribe many problems we face in the world separately, but in fact, these are quite linked together in many ways. For example, as we mentioned, we cannot investigate problems like food insecurity and refugee crisis disconnected with other contexts. Today, in this conference, we were able to explore the intertwined realities of many problems and climate environmental crisis. I hope it was an opportunity for you to rethink about humanitarian issues in the world through the lens of planetary health and in relation to the health of this planet. 우리가 살아가다가 당면하는 여러 가지 그런 문제들, 빈곤 문제, 식량 문제 이런 것들이 사실 각각 떨어진 별개의 것이 아니라 보다 복합적으로 연계된 경우가 많습니다. 문제를 표면적으로만 인식하면은 식량위기는 그냥 식량의 문제, 또 난민위기는 정치적이거나 실향의 문제로만 제한적으로 이해할 수 있습니다. 하지만 오늘 우리가 배운 대로 또 다양하게 들은 대로 여러 가지 지식을 접하면서 현재 우리가 겪고 있는 많은 문제들이 실제로는 환경과 기후의 변화와 연계되어 있다는 것을 많이 실감을 했는데요. 이번 지구보건 컨퍼런스를 통해서 여러분들께서 세계 곳곳에서 일어나는 인도적 위기를 보다 통체적으로 이 지구라는 행성이 겪고 있는 문제, 우리의 환경이 겪고 있는 문제, 즉 지구보건의 관점에서 이해할 수 있는 그런 기회가 되었기를 마음 깊이 바라고 있습니다. 병든 지구에서는 우리도 건강할 수가 없습니다. Thank you very much. 감사합니다.